Hello everyone, I am Dr. Ziyad. Welcome to the AAPC CPC mock exam 2. In this mock exam, we will go through all 100 multiple choice questions organized by chapter, just like the real CPC exam. I will explain you how to find the answers easily and quickly. So make sure to subscribe my channel and check out my playlist. Chapter 1 Medical Terminology. There are 4 MCQs. Question number 1. The procedure known as blepharoplasty is performed to A. Correct the muscle misalignment caused by strabismus. B. Correct vision loss due to glaucoma. C. Plastic repair a droopy eyelid. D. Repair the lens of the eye caused by cataracts. So answer the question. The correct answer is C. Plastic repair a droopy eyelid. You can see here, this is the blepharoplasty procedure. The excess skin removed from eyelids and also reduce bagginess here. So the blepharoplasty, also known as eyelid surgery, is a cosmetic surgical procedure to improve the appearance of the eyelids. It can address issues like excess skin or fat in the upper or lower eyelids, drooping eyelids, or bags under the eyes. This procedure can restore a more youthful and rested appearance to the eye area. So the correct answer here is answer C. Question number 2. A blood disease that is characterized by an abnormal increase in the amount of white blood cells in the body is normally referred to as A. Lymphadenitis, B. Thrombophlebitis, C. Leukemia, D. Lymphoma. Answer the question. So here you have to highlight this is abnormal increase in white blood cells. So correct answer is C. Leukemia. So when you take the other answer, the lymphadenitis, this refers to the inflammation of lymph nodes typically due to infection. B. Thrombophlebitis, this is inflammation of a vein associated with the formation of a blood clot. It is a circulatory condition, not a blood. Leukemia, this is a group of cancers that usually begin in the bone marrow and result in high number of abnormal blood cells. These abnormal blood cells are often immature and cannot perform their normal functions, leading to various health problems. When you take lymphoma, this is a cancer of lymphatic system, which is a part of body's germ-fighting network. While it involves lymphocytes, a type of white blood cell, it primarily forms a solid tumors in the lymph nodes or other lymphoid tissues. So here the correct answer is answer C, leukemia. Question number 3. Hemiplegia is a disorder caused by a defect in which anatomic system? A. Musculoskeletal, B. Nervous, C. Digestive, D. Integumentary. Answer the question. So the correct answer is B. Nervous. So hemiplegia may cause problems with other body systems but has its roots in the nervous system. Hemiplegia is a paralysis or reduced movement of one side of the body. So when you take the cerebral palsy, there are 4 types available. The first one is monoplegia. The monoplegia means it affects the one limb, usually arm. Hemiplegia means affects one side of the body, including the arm, leg, and trunk. Diplegia means affects the symmetrical part of the body, legs or arms. Quadriplegia means it affects the all 4 limbs. So here the correct answer is B. Nervous. Question number 4. What suffix denotes the surgical removal of the gallbladder when describing common medical procedures precisely? A. Lysis, B. Ectomy, C. Otomy, D. Ostomy. Find the answer. So the correct answer is ectomy, B. So when you take lysis, this suffix means breaking down, separation or dissolution or loosening. For example, hemolysis is the breakdown of red blood cells and thrombolysis is the dissolution of a clot. It does not denote surgical removal. Ectomy means this suffix specially denotes the surgical removal or excision of an organ or part. For example, cholecystectomy is the surgical removal of gallbladder, and appendectomy or appendicectomy is the surgical removal of appendix. Otomy, this suffix means cutting into or surgical incision. For example, tracheotomy is an incision in the trachea and gastrotomy is an incision into the stomach. It implies making an opening, not necessarily removing the organ. Ostomy, this suffix means to create a surgical opening or mouth. For example, colostomy is a surgical opening from the colon to the outside of the body, and tracheostomy is a surgically created opening in the trachea. It denotes creating a permanent or semi-permanent opening, not removal. Chapter 2 Anatomy. There are 4 MCQs. Question number 1. Which part of the brain controls blood pressure, heart rate, and respiration? A. Cortex, B. Cerebellum, C. Cerebrum. D. Medulla. Answer the question. The correct answer is D. Medulla. So when you take the overall structure of the brain, you can see here the cortex is the outermost layer of the brain. It's primarily involved in high-level functions such as thought, voluntary movement, language, reasoning, and perception. And the cerebrum you can see this whole part is the cerebrum. So the cerebrum is the largest part of the brain responsible for conscious thought, voluntary actions, memory, and sensory processing. Cerebellum, you can see here, is located at the backside of the brain beneath the cerebrum. Its main function is include coordinating voluntary movements, balance, posture, and motor learning. When you take medulla or the medulla oblongata, it belongs to the part of the brain stem. It is the primary control center for many autonomic, that is, involuntary functions essential for life, including regulating breath, respiration, heart rate, and blood pressure, as well as reflexes like sneezing, coughing, vomiting, and swallowing. All are controlled by the medulla or medulla oblongata. So the correct answer is D. Question number 2. Which of the following is true about the tympanic membrane? A. It separates the middle ear from the inner ear. B. It separates the external ear from the middle ear. C. It sits within the middle ear. D. It sits within the inner ear. So think the answer. The correct answer is B. It separates the external ear from the middle ear. You can see in the picture the tympanic membrane we call as eardrum. It is here. It forms a boundary between the external auditory canal, that is the part of the external ear, and the air-filled tympanic cavity, that is part of the middle ear. So the correct answer is B. It separates the external ear from the middle ear. Question number 3. The myocardium is thickest around which chamber of the heart? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. It's a straightforward question. So answer the question. So the correct answer is D. Left ventricle. When you see the 4 chambers of the heart, you can see the left ventricular wall is thicker. So the left ventricle pumps oxygenated blood to the entire body, that is the systemic circulation. This requires a significant amount of force to overcome the high resistance of the systemic arteries and propel blood for the farthest parts of the body. Consequently, the muscular wall of the left ventricle, that is myocardium, is the thickest and most powerful chamber of the heart. Question number 4. Spongy bone tissue A is found along with the shafts of the heart bones. B is found along the outer layer of bones. C makes up the top edges of long bones. D makes up insides of the bones. So think the answer. The correct answer is D, makes up the insides of bones. You can see structure of the long bone. This part is epiphysis, and here is the metaphysis. This the long part is diaphysis. Same thing in the down also. So when you see the spongy bone, you can see the spongy bone is here. The spongy bone, also known as the cancellous or trabecular bone, is characterized by its porous lattice-like structure. It is found in interior of bones, particularly in the epiphysis of long bones, the vertebral bodies, and flat bones surrounding the bone marrow. Spongy bone tissue helps make bones lighter in weight and provides an area for bone marrow to provide red blood cells. This arrangement provides strength without excessive weight and allows for efficient distribution of stress. So the correct answer is spongy bone makes up the insides of bone. Chapter 3, Compliance and Regulatory. There are 3 MCQs. Question number 1. An advanced beneficiary notice ABN is used for A. To document a patient's consent for a surgical procedure. B. To inform patients about potential charges for services that may not be covered by Medicare. C. To request pre-authorization for a surgical procedure. D. To provide a detailed surgical report to the patient. So think the answer. The correct answer is B. Some services are not covered by Medicare in healthcare centers. The ABN is used to inform patients about potential out-of-pocket costs for these services. This ensures that they are aware of their financial responsibility. So the correct answer is B. ABN is used to inform patients about the potential charges for services that may not be covered by Medicare. Question number 2. How relative value units RVUs are significant in surgical services? A. They determine the geographic variations in the cost of surgery. B. They dictate the frequency of surgical audits. C. They provide guidelines for minimum necessary documentation. D. They measure the value of surgical services based on work, practice expenses, and malpractice. So find the answer. The correct answer is D. That is, RVUs, they measure the value of surgical services based on work, practice expenses, and malpractice. So the RVUs are a core component of Medicare physician fee schedules. and are widely adopted by many commercial payers. RVUs are designed to reflect the resources typically required to provide a service. Each CPT code, including surgical code, is assigned RVUs across three main components. First one is physician work, represent the physician's effort, skill, time, and intensity required for a service for surgical services. This is a significant component reflecting the complexity of the procedure itself. Practice expense covers the non-physician costs of running a medical practice, such as rent, supplies, equipment, and clinical and administrative staff salaries. Malpractice accounts for cost of professional liability insurance. These RVUs are then adjusted by geographic practice cost indices and multiplied by conversion factor to determine the final payment amount for a service. Therefore, RVUs are fundamental to determine reimbursement for surgical services. Question number 3. A physician performs a rhinoplasty on a 2-year-old male with a nasal breathing problems. The child was born with a congenital cleft lip and palate with nasal deformity. Cleft and partial deformity was repaired when the boy was an infant, but the breathing problems have persisted and are a direct result of the congenital nasal deformity. Now the child can withstand a more intensive procedure. The surgeon performs the rhinoplasty to complete the correction of the deformity. What will likely happen with the processing of this claim? As long as they receive documentation of the procedure's medical necessity. So the first answer is A. Insurance will deny the claim as a cosmetic procedure. B. Insurance will pay for the claim as medically necessary. C. Insurance will initially deny the claim as medically necessary and then pay for the cosmetic procedure. D. Insurance will not process the claim. So find the answer. So here the correct answer is insurance will pay for the claim as medical necessary. During the processing of the claim, insurance likely pay for the claim as medically necessary, even though it is a rhinoplasty which can be done as a cosmetic procedure. In this case, it is considered medically necessary due to the fact that the child is experiencing breathing problems from the congenital deformity and needs a rhinoplasty to correct the problem. If the procedure was purely for cosmetic reasons, if the patient wanted simply to change the shape of the nose, then insurance would not pay for it as it would not be medically necessary. So here the correct answer is B. Chapter 4 Coding Guidelines. There are 7 MCQs. Question number 1. When should a coder use a combination code in ICD-10-CM to report a condition and its manifestation? A. Use only for external causes. B. When a combination code exists. C. After using the exclusion instructions. D. For separate code applicability. Think the answer. The correct answer is B. When a combination code exists. The ICD-10-CM official guidelines for coding and reporting state that multiple codes should not be used when a single combination code can be used to describe a condition and its manifestation. A combination code is a single code that classifies two diagnoses: a diagnosis with an associated secondary process, that is manifestation, or a diagnosis with an associated complication. So for example, a patient with type 2 diabetes mellitus is seen for a diabetic polyneuropathy. So here the condition is the type 2 diabetes mellitus and the manifestation is the diabetic polyneuropathy. So we no need to code both conditions separately because there's a combination code, that is E1142 is type 2 diabetes mellitus with diabetic polyneuropathy. So we can use this combination code for both conditions. Question number 2. What does a parenthetical C instruction signal the coder to do in an ICD-10-CM codebook? A. Sequence principal diagnosis first. B. Consult alternative code entries. C. Review diagnostic test codes. D. Apply general coding guidelines. Think the answer. So correct answer is B. Consult alternative code entries. ICD-10-CM alphabetic index, a parenthetical C instruction is a cross-reference that directs the coder to another term or a different location in the index to find the correct code. It's a crucial tool for navigation when the initial term you look up doesn't have the code directly associated with it, or when the initial term is not the most specific or the appropriate one. For example, when you search for the pathological fracture, you can go to the fracture pathological. So within bracket it says see also fracture traumatic. So again we have to go to the fracture, then traumatic, you can find the correct code. Question number 3. When a CPT code has the words separate procedure in the parentheses after code description, you A. Do not use this code if it is listed as the separate procedure. B. Code for all other elements of the procedure except this one. C. Only code for this procedure if it was the only thing performed. D. Code for this procedure even it was not performed. So think the answer. So here correct answer is C. Only code for this procedure if it was the only thing performed. So in CPT coding, when a procedure is labeled as separate procedure, noted in the parenthesis after the code description, it means the procedure is usually included as a part of a more extensive related procedure and is not reported separately when performed as a component of the another procedure. However, if the separate procedure was performed independently, that is, not as a part of a more comprehensive or related procedure, then it may be coded and reported. So I'll show you an example. So here you can see the code 45300 is proctosigmoidoscopy, rigid, diagnostic with or without collection of specimens by brushing or washing. So within bracket it says separate procedure. If it is performed during a larger colorectal procedure, you no need to report it separately because the procedure itself will contain this part. But you have to report it if done independently to investigate rectal bleeding. So proctosigmoidoscopy done independently, you can use this code. If it is done with the major procedure, you have to use the major procedures code, not this separate code. Question number 4. Which global period applies to major surgical procedures under the CMS Global Surgery Package, including post-operative follow-up care? So there are 4 answers. First one is 0-day global period, B 10-day global period, C 30-day global period, D 90-day global period. So think the answer. The correct answer is D 90-day global period. So under the Centers for Medicare and Medicaid Services Global Surgery Package, surgical procedures are categorized by their global periods, which define the time frame of services included in a single payment for the surgery. So the 90-day global period, that is for major procedures, this is the period assigned to major surgical procedures. Payment for the surgery includes all the routine pre-operative, intraoperative and post-operative care provided by the surgeon and their group for 90 days following the surgery. This period typically includes one pre-operative visit the day before the surgery or on the day of the surgery, and the 90 days after the procedure. All follow-up visits related to the surgery within this 90-day period are bundled into a single surgical fee and cannot be billed separately. Similarly, the zero-day global period applies to certain minor procedures such as endoscopies and includes only the services performed on the same day as the procedure. 10-day global period applies to most other minor procedures and includes the day of the procedure and the 10 days immediately following it. Question number 5. For significantly more complex procedure than typical, what CPT modifier should be appended? So there are 4 answers, 51, 57, 22 and 54. So find the answer. So here the procedure is complex, so it needs more time and more effort. When you see the CPT modifiers in the back side of the front cover, you can go through all the codes. So code 24.2 is increased procedural services, 51 for multiple procedures, 54 for surgical care only, 57 for decision for surgery. So in this case, the correct answer is C22, that is increased procedural services. Question number 6. Which CPT category contains temporary codes for emerging technologies and procedures under evaluation? A. Category 1, B. Category 2, C. Category 3, D. HCPCS Level II. Think the answer. So the correct answer is C. Category 3. So Category 3 CPT codes are provisional entries for emerging technologies, procedures, and services under review. Category 1 covers the standard services. Category 2 is for performance tracking. HCPCS Level 2 covers services, supplies, drugs, and equipment not found in the CPT code set. Question number 7. How should the CPC proceed during a coding condition that is described as both acute and chronic? A. Only code the acute condition. B. Only code the chronic condition. C. Code both conditions. D. Exclude coding as both conditions are mutually exclusive. Think the answer. So here the correct answer is code both conditions. So that is answer C. When a condition is documented as both acute, that is sudden onset or short duration, and chronic, that is long-term or persistent, it means the patient is experiencing an exacerbation of their pre-existing chronic condition. According to the ICD-10-CM official guidelines for the coding and reporting, Both the acute and chronic conditions should be coded. So there are 7 questions appear in the coding guideline. Chapter 5 ICD-10 CM codes. There are 5 MCQs. Question number 1. A pregnant patient at 20 weeks of gestation without proteinuria is newly diagnosed with gestational hypertension. Which ICD-10 CM code best captures this condition? So there are 4 answers available. All are adjacent codes. So please take your ICD-10 CM code book and find the answer. Okay, in this case, you have to highlight this is a pregnant patient with 20 weeks of gestation without proteinuria but with gestational hypertension. When you look at the answer, you will see all the answers are with O series and adjacent codes. So you can directly go to the codes and find the answer using elimination method. O13 is gestational, that is pregnancy-induced hypertension without significant proteinuria. But when you look at other codes, O13.1, 2, and 3, you can see first trimester, second trimester, and third trimester. So you had to know this 20 weeks belongs to which trimester. So when you see the AAPC guideline, you can see the first trimester is less than 40 weeks. That means first 3 months is called first trimester, second trimester is called second trimester, and third 3 months up to delivery is called the third trimester. So in this case, less than 14 weeks, that is up to 13 weeks, it is first trimester. From 14 to 28 weeks, it is called second trimester. After 28 weeks until the delivery, it is called third trimester. So when you consider this 20 weeks, it is belongs to the second trimester. So you have to code this condition using the second trimester code. So when you go to the code 013.2, that is gestational pregnancy-induced hypertension without significant proteinuria, second trimester. So this is the correct answer. So the correct answer is D, that is O13.2. If you are using the ICD-10 CM alphabetic index to find the answer, here you have to go to the alphabetic index, you have to go to the hypertension, gestational. It will lead you to the C, hypertension complicating pregnancy. So there you have to go pregnancy-induced hypertension without proteinuria. It will lead you to the O13 code series. Again, you have to go back to the tabular list and confirm the answer. So once you confirm the answer, the correct answer will be answer D. Question number 2. A patient fell into an outstretched left hand by slipping and sustained a closed fracture of the distal radius. Which ICD-10 CM code should be reported? So there are 4 answers available. Take your ICD-CM code book and find the answer. Okay, in this question, you have to highlight this is a fell on left hand by slipping. And the fracture occurred here is closed fracture of the distal radius. So when you look at the answers, you can see all answers are adjacent codes. S52 and W01 codes are available. So you can find the answer using elimination method. So directly go to the codes. So when you go to the code S52.5, that is fracture of lower end of radius. In our case, distal radius means that is lower end. So that is correct. And the laterality is here left hand. So when you go into further codes, you can see for S52.50 is unspecified. 501 is unspecified fracture of the lower end of the right radius. 502 is left radius. So in our case, left radius distal fracture. So the correct code will be S52.502. But in this fracture code, you had to give the 7th code, that is the initial encounter or subsequent encounter, those kind of things. Here it is the initial encounter, so you have to use the additional code A. So here you can eliminate other 2 answers. So this S52.502, there are 2 answers A and C available. So you can eliminate this B and D. So let's go to the external cause of injury codes. So here when you go the code, W010 is fall on the same level from slipping, tripping and stumbling without subsequent striking against object. Other codes 1.1 is subsequent striking against an object. But in this case, it is not mentioned any object. So you can use this one, W01.0, that is fall on the same level from slipping, tripping and stumbling without subsequent striking against object. Here also you have to use the 7th character. So there are 4 codes available. So for the numerical order, you have to add this 2 X's and A. That is for initial encounter. So the correct answer is A. So if you want to find the answer using the ICD-10 CM alphabetic index, first you have to find the fracture code. So First, you have to go to the fracture, then go to the subcategory of radius, then go to the lower end, that is distal. It will lead you to the code series of S52.5. Again, go back to the tabular list and find the answer. Similarly, the external course codes, you have to go to the fall, then the subcategory of same level, then the category of slipping, tripping, and stumbling. It will lead you to the code series of W01. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer A. Question number 3. A 60-year-old patient presents with an acute ST segment elevation myocardial infarction involving the left anterior wall. Which ICD-10-CM code should be reported? So there are 4 codes available. Take your ICD-10-CM code book and find the answer. Here you have to highlight this is acute ST elevation MI involving the left anterior wall. When you look at the answer, you can see all are adjacent codes available. So you can use the elimination method to find the answer. So directly go to the codes. So when you go to the codes, you can see I21.0 is ST elevation, that is STMI, myocardial infarction of anterior wall, but here the laterality is not mentioned here. But when you look at other code, I21.01 ST elevation myocardial infarction involving the left main coronary artery. So in our case, left anterior wall, so left coronary artery involved. So the correct answer will be I21.01. So the correct answer is answer C. So if you are using the alphabetic index, you have to go to the index of infarction, then go to the subsection of myocardial, then go to acute, then ST elevation. After that, you have to go to the anterior wall. It will lead you to the code I21.0. So again, go back to the tabular list and you have to confirm the answer. Once you confirm the answer, the correct answer will be answer C. Question number 4. A patient is diagnosed with hypertensive chronic kidney disease, stage 3, without heart failure. Which ICD-10-CM codes should be reported? So there are 4 answers available. Take your ICD-10-CM code book and find the answer. Here you have to highlight this is hypertensive chronic kidney disease stage 3. When you look at the answer, each answer having 2 codes and all codes are adjacent codes. So you can use the elimination method to find the answer. So directly go to the code. So first let's start with the I codes. So when you go to the I12.9, that is hypertensive chronic kidney disease with stage 1 through stage 4. Chronic kidney disease or unspecified chronic kidney disease. So here hypertensive chronic kidney disease part is fulfilled. So that is here hypertensive chronic kidney disease. So the correct code here will be I12.9. So there are 2 answers available with I12.9, that is A and D. So you can eliminate this B and C. On the footnote, you can see use additional code to identify the stage of the chronic kidney disease. So the staging, you have to use the additional codes, that is N code, N18 code you can use. So you have eliminated this B and C, and let's go to the N18 codes. So N18.3, that is chronic kidney disease stage 3 moderate, N18.6, that is end stage. So in our case, this is stage 3 disease. So the correct code will be N18.3. So the correct answer will be answer A. So if you're using the ICD-10-CM alphabetic index, first you have to go to the hypertension, then subcategory of with kidney disease, then go to chronic, then it will lead to the stage 1 to 4 or unspecified without heart failure. So it will be lead to the code I12.9. If the heart failure is present, you would use the code I12.0 instead. Then look up the disease. There you will get kidney, then chronic, then stage 3, that is moderate. It will lead you to the code N18.3. So the correct answer will be answer A. Question number 5. An asymptomatic patient receives pneumococcal conjugate vaccine during a preventive care visit. Which ICD-10-CM code should be assigned to indicate this encounter? So there are 4 codes available. Take your ICD-10-CM code book and find the answer. So here you have to highlight this is a pneumococcal conjugate vaccine during a preventive care visit. So when you look at the codes, there are 4 Z codes used. So you can use the elimination method to find the answer. So when you go to the Z code 28.2, that is immunization not carried out because of patient decision for other and unspecified reason. So A is not possible. B is Z79.82, that is long-term current use of aspirin. So that also not suitable. Z0.00, that is encounter for general adult medical examination without abnormal findings. So that also not possible. So the answer D is Z23, that is encounter for immunization. So that answer is correct. But here in this case, you can see this is a pneumococcal conjugate with the preventive care visit. So for the preventive care visit, you had to use the CPT code, and the type of vaccine, that is pneumococcal conjugate, you had to use the HCPCS code. So the ICD-10-CM code only covers the vaccine administration in general. So you can see the procedure codes are required to identify the types of immunization given. So the correct answer for this question is answer D. So if you use the alphabetic index, go to the ICD-10-CM alphabetic index. There you'll go to the vaccination, then go to the subcategory of encounter for. It will direct you to the Z23 code, that is encounter for immunization. On the claim, the Z23 code is paired with the CPT and HCPCS vaccination administration code and the specific vaccine product code. So the correct answer here will be answer D. So this is the end of the ICD-10-CM chapter. Please subscribe my channel. Mock exam 2, chapter 6. HCPCS Level 2, there are 3 questions. Question number 1. An interfacility non-emergency transport of a stable patient requiring advanced life support interventions from a hospital to a skilled nursing facility is arranged. Which HCPCS Level 2 code should be reported for this ALS ambulance transport service? So there are 4 answers available. Take your HCPCS codebook and find the answer. So here you have to highlight this is interfacility non-emergency transport requiring advanced life support to the hospital to the skilled nursing facility, asking for the code for ambulance transport service. When you look at the codes, all are adjusted codes. So you can use the elimination method to find the answer. So when you look at the codes, A0425 is for ground mileage, so that is not suitable here. A0426 is ambulance service, advanced life support, non-emergency transport. So that is correctly represents the condition. Here you can see ambulance service, advanced life support, non-emergency service. So the correct code will be A0426. When you look at other codes, those are not suitable. For example, 427 is ambulance service, advanced life support, emergency transport. In our case, it is not emergency. 428 is ambulance service, basic life support, but in our case, it is advanced life support. So the correct answer is answer B. If you are using the HCPCS alphabetic index, you have to go to the index of ambulance, then you have to go to the subcategory of advanced life support. It will redirect you to the following 3 codes. Again, you have to go back the tabular list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 2. A patient receives a 5 mg intramuscular injection of leuprolide acetate in a clinic setting for prostate cancer treatment. Which HCPCS Level 2 code and the number of units should be reported to accurately reflect administration under Medicare billing standards? So when you look at the answer, there are 4 answers available. All are adjacent codes. So take your HCPCS codebook and find the answer. So in this case, you have to highlight this is 5 mg intramuscular injection of leuprolide acetate. Directly go to the code and find the answer. So when you go to the code J0640 is injection leucovorin calcium. When you look at the question, it says leuprolide. So that is not suitable here. When you look at other answer, J9218, that is leuprolide acetate per 1 mg. So when you look at the question, it says leuprolide acetate 5 mg. So this code for only 1 mg. So if you want to code 5 mg, you have to multiply this code with 5. So the correct answer is answer D. So if you want to find the answer using the alphabetic index, you have to go to the HCPCS Level 2 alphabetic index. There you have to find the leuprolide acetate. This redirect you to the code J928. That is for leuprolide acetate for 1 mg. Since the patient received 5 mg, you have to multiply the code with 5. So the correct answer will be answer D. Question number 3. A home health patient diagnosed with obstructive sleep apnea requires a continuous positive airway pressure device for nightly therapy. Which HCPCS Level 2 code applies for billing this DME equipment? There are 4 answers available. Take your HCPCS codebook and find the answer. Here you have to highlight this is continuous positive airway pressure device. When you look at the answers, all answers are using the E codes, relatively adjacent codes. So you can use the elimination method to find the answer. So once you look at the code E0601, that is says continuous positive pressure device, that is CPAP. So that is the correct answer. Here when you look at other answers, E0424, that is station stationary compressed gaseous oxygen system. 1390 is oxygen concentrator. 784 is external ambulatory infusion. So in this case, the correct answer will be answer A. So if you are using HCPCS alphabetic index, first you have to go to the index and look up the positive ARV pressure device. It redirects you to the E0601 code, that is continuous positive pressure ARV device. So the correct answer will be answer A. So this is the end of the HCPS level 2 questions. Chapter 7, CPT 10,000 series questions. There are 6 questions. Question number 1. A 30-year-old patient undergoes a procedure for a scalp defect where a physician surgically inserts a tissue expander. The operation also includes the initial filling and subsequent expansions with saline solution to stretch the tissue for the final reconstruction. Which CPT code accurately reports the procedure? So there are 4 CPT codes available. Take your CPT code book and find the answer. So here you have to highlight, this is an insertion of tissue expander, initial filling and subsequent expansion with saline solution. So to stretch the tissue for final reconstruction. These are the main terms you have to highlight. When you look at the answer, you can see A and B are the adjacent codes and other 2 codes are deviated codes. So you can use both ways to find the answer. What first method is elimination. You can directly go to the code and find the answer, or else you can use the CPT alphabetic index and find the answer. First, I'll tell you how to find the answer using elimination method. So first go to the code. First code 11,960. It says insertion of tissue expander for other than breast, including subsequent expansion. So this is exactly mentioned our procedure, that is the expander inserted and subsequent expansion. You can see expander inserted and the subsequent expansion other than breast. So here the procedure done on the scalp, so other than breast. So this code is more suitable for the answer. Let's check other answers as well. 970 is replacement of tissue expander with permanent implant. That is not the condition here. And the code C, that is 15,777 is implantation of biologic implant. That is not the condition here. 19,357 is tissue expander placement in breast reconstruction, including subsequent expansion. This is the condition here, but this is not done in the breast. This is done in the scalp. So the correct answer should be answer A, that is 11,960. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the main procedure, that is expander. So go to expander, it says skin inflatable. On the down it says C, tissue expander. So again you have to go to search for the tissue expander. So once you go to the tissue, again go to the subcategory of expander, then go to the subcategory of insertion, then skin. It will lead you to the code 11,960. Again go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer A. Question number 2. A 50-year-old woman is evaluated for 2 new hypoechoic masses in her left breast. In the outpatient radiology suite, an interventional radiologist performs fine needle aspiration biopsies on both lesions using continuous ultrasound guidance. First, a fine needle is inserted into the 1.6 centimeter lesion to obtain multiple cytologic samples. The physician then redirects the same needle to sample the second 1.1 centimeter lesion to obtain additional specimens. Which 2 CPT codes correctly report these procedures? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight, this is fine needle aspiration biopsy on 2 lesions using the continuous ultrasound guidance. First lesion is done, that is 1.6 centimeter. The same needle used for the second lesion, that is 1.1 centimeter. Both are done using the ultrasound guidance. So when you look at the answer, you can see adjacent codes are used. A, B, and C are all adjacent codes, and D is somewhat different code. So you can use elimination method or the CPT alphabetic index. So let's use the elimination method first. So the code 10,021 is fine needle aspiration biopsy without imaging guidance. But in our case, we have used the ultrasound guidance. So this is not possible. Next answer 10,005, that is fine needle aspiration biopsy including ultrasound guidance first lesion. So this is suitable. Plus the second code 10,006, that is each additional lesion. So there are 2 lesions we have used, both are done using ultrasound guidance. So 10,005 and 10,006 are the correct answers. So you can directly go for the answer C. If we check other codes, like 76,942 is ultrasonic guidance for the needle placement. So here that
this is not the needle placement. This is the fine needle aspiration biopsy. And if you go to 19,000, that is puncture aspiration of sister breast. But our one is fine needle aspiration, not the puncture aspiration. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So in the CPT alphabetic index, directly you have to go to the term fine needle aspiration biopsy. So there's the index called fine needle aspiration biopsy, subcategory lesion. So there are multiple options available. So here CT guidance, fluoroscopic, MRI with ultrasound guidance. So our case is with ultrasound guidance. So it redirects you to the following two codes, 10,005 and 10,006. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C.
Question number 3. A 57-year-old woman presents to the office with 5 painful hyperkeratotic calluses on her hands. In a single visit, the physician soaks both hands, then pares and removes all 5 calluses using a scalpel until only healthy tissue remains. Which CPT code correctly reports the treatment of these lesions? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight this is hyperkeratotic callus on her hand, pares and removes all 5 calluses using a scalpel. So when you look at the answer, all codes are adjacent codes. A, B, C and C are very nearby codes and D deviated code. So you can use the elimination method to find the answer. Also, I will explain the alphabetic index method also. So when you go to the codes, 11,055, that is pairing or cutting of benign hyperkeratotic lesion, single lesion. In our case, it is 5 calluses. So 56 is 2 to 4 lesions. 57 is more than 4 lesions. So in our case, this is 5 lesions. So that is more than 4. So the correct answer will be 11,057. So correct. The C is the correct answer. When you look at the answer D, that is shaving of epidermal or dermal lesion. So this is not the shaping, this is parsing. So the correct answer is answer C. So if you use the alphabetic index, directly go to the index of pairing. Again, go to the subcategory of skin lesion. There you have to go to the subcategory of benign hyperkeratotic. It will lead you to the code series of 11,055 to 57. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 4. A 30-year-old male presents with a small raised lesion on his right forearm that has been present for approximately 6 months. The lesion is not painful, stable in size, and measures 0.5 centimeter in diameter. The patient works outdoors and has significant sun exposure. The dermatologist suspects the lesion is benign but decides to excise it for cosmetic lesions and further examination. Which CPT code correctly reports the removal of this lesion? So there are 4 codes available. Take your CPT code book and find the answer. So in this case, we have to highlight this is the lesion on the right forearm, 0.5 centimeter in diameter. The dermatologist suspects the lesion as benign and decides to excise for cosmetic lesions and for further examination. When you look at the answer, all codes are adjacent codes. So you can use the elimination method to find the answer. Also, I will explain how to find the answer using alphabetic index. So first go to the code 11,305, that is shaving of epidermal or dermal lesion. In our case, this is excision, not shaving. So this answer is not possible. 11,400, that is excision, benign lesion including margins except skin tag, trunk, arms, legs, excise diameter 0.5 centimeter or less. In our case, it is 0.5 centimeter, excision, and the lesion on the right forearm, so arms. So all the conditions are fulfilled by this code, that is 11,400. So correct answer will be answer B. When you check other codes, 11,055, that is pairing or cutting. That is not the case here. 11,600 is excision of malignant lesion. Here we are suspecting this is as the benign lesion. So the correct answer will be answer B. So if you are encounter this case in a real working scenario, you have to use the CPT alphabetic index. When you go to the CPT alphabetic index, first you have to go to the term excision, then go to the subterm lesion, then go to skin, then go to the subcategory of benign. It will lead you to the following code series. Again, you have to go back to the tabular list and we have to start searching from 11,400 to other codes. So when you search, the correct answer will be answer B. Question number 5. A 5-year-old is brought to the emergency department to repair 2 lacerations, a 3 centimeter laceration on her right arm and a 2 centimeter laceration on her nose. Her arm is repaired with a single 1-layer closure with sutures. Her nose is repaired with a simple repair using tissue adhesive, that is 2-cyanoacrylate. How are the repairs reported? So there are 4 answers available.
take you a CPT code book and find the answer. Here you have to highlight there are two lacerations. First one is 3 centimeter laceration on her right arm and 2 centimeter laceration on her nose. Arm one is repaired with the simple layer closure, that is suture, and the nose one is repaired with the simple repair using tissue adhesive. So when you look at the answer, all codes are adjacent codes, 12,011, 32, 2. So you can use the elimination method to find the answer. So directly go to the code. So when you look at the code 12,011, that is simple repair of superficial wounds of face, ears, eyelids, nose, lips or mucous membrane. Both lacerations are repaired with a simple repair because first one is simple layer closure, second one is tissue adhesive. So both are simple repair. So 12,011 is simple repair of superficial wounds of face, ears, eyelids, nose, lips. So nose one included here. So the second one, her nose is repaired with a simple repair. The nose, the laceration in the nose is 2 centimeters. So here is 2.5 centimeter or less. So for nose, you can use this code 12,011. When you look at other code 12,031, that is repair intermediate. But our two lacerations are simple, not the intermediate. So you can use this code. So 32 also not possible. 12,041 also repair intermediate. So that also not possible. 12,001, that is simple repair of superficial wounds of scalp, nail, neck, axilla, external genitalia, trunk or extremities, including hands and feet, 2.5 centimeter or less. In our case, the hand laceration, the right arm laceration is 3 centimeter. So 2.5 or less, you can use the 12,001. So it is more than 2.5, you can use the 12,002. That is 2.6 into 7.5 centimeter. In our case, the hand laceration is 3 centimeter. So you had used this code as well. So the correct answer will be 12,002 and 12,011. That is for the nose one. The modifier 59 is used as this is the distinct separate procedure because both are simple repair, but one is done on the nose and other one is done on the hand. So the correct answer will be answer D. If you encounter this case in a real working scenario, you have to use the CPT alphabetic index. When you go to the CPT alphabetic index, for the laceration one, that is on the right arm, 3 centimeter one, you have to go to the term repair, then go to the subterm wound, then go to the subterm simple, that is simple repair. So this is the order: repair, wound, then simple. It will lead you to the following code series 12,001 to 12,021. Again, go back to the tabular list and confirm the answer. Similarly, laceration 2 also, same way you have to follow: repair, wound, symbol, again the same code series. Once you confirm with the tabular list, the correct answer will be answer D. Some people might say answer C because the second simple repair that using the tissue adhesive may not be billed. Yes, some payers are not billed for this repair using tissue adhesive, but CPT coding you had to use the code, but for the billing purpose only they may accept or may not accept. But the CPT coding you had to code for both procedures. Question number 6. A 35-year-old female has cancer in her left breast. The surgeon performs a mastectomy, removing the breast tissue, skin, pectoral muscles, and surrounding tissue, including the axillary and internal mammary lymph nodes. Which CPT code is reported? So there are 4 CPT codes available, all are adjacent codes. Take your CPT code book and find the answer. So here you have to highlight this is mastectomy and the removing the breast tissue, skin, pectoral muscles and surrounding tissue, including the axillary and internal mammary lymph node. So when it comes to the mastectomy, there are several types available. For example, simple, modified, radical. So there are several types depend on the tissue layers removed. So you have to be careful when you going for the answer. So when you look at the answer, all answers are very adjacent, 303, 5, 6 and 7. So you can use the elimination method easily to save your time. So when you go to the answer, 19,303 is mastectomy, simple, complete. But this can't be the answer because it is not mentioned the other parts. So when you go to the other answer, 305 is mastectomy, radical, including pectoral muscle, axillary lymph node. So this is almost matching the procedure, but this internal mammary lymph nodes part is missing. When you look at the other answer, 19,306 is mastectomy, radical, including pectoral muscle, axillary and internal mammary nodes. So this is exactly matching the procedure here. Removing breast tissue, skin, pectoral muscles and surrounding tissue, including axillary and internal mammary lymph. If you look at the other answer, 19,307 is mastectomy, modified radical, including axillary lymph nodes with or without pectoralis minor muscle, but excluding pectoralis major. But here it includes the pectoral muscles. So this code also not possible. So the correct answer will be 90,306. So that is answer C. So when you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So you can directly go to the index of mastectomy. So when you go to the mastectomy, you will get following, you will get all category of mastectomy types. So here you can see modified radical, partial radical, simple. So when you are not sure which category this procedures belongs to, you can go to any code and you can read other code description as well. So you can start with the 302, 3, 4, 5, 7. So when you read the description, you will find that correct answer will be answer C. This is the end of mock exam 2 CPT 10,000 series questions, chapter 8 CPT 20,000 code series that include musculoskeletal system. Question number 1. A patient with a congenital maxillary hypoplasia and midface deformity undergoes Leaford eye osteotomy for reconstruction. During the procedure, the surgeon performs a Leaford eye advancement and reconstruction of the midface, including two-piece segmental osteotomies of the maxilla with bone grafting to reposition the dental arch and restore facial symmetry. What is the correct CPT code to report this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight, this is maxillary hypoplasia and midface deformity. Leaford 1 osteotomy for reconstruction is used. So reconstruction of the midface with two-piece osteotomies with bone grafting. So these are things you have to highlight. When you look at the answer, all answers are adjacent. So for the quick answer in the exam, you can use the elimination method and directly go for the course. But for the real working scenario, you have to use the CPT alphabetic index. So I will explain the both methods. So when you go to the code, 21,141 is reconstruction midface, Leaford 1, single piece segment movement in any direction without bone graft. In our case, 2 pieces with bone grafting. So this is not suitable answer. 42 also 2 pieces but without bone graft. So this is not suitable answer. 45 is single piece. 21,146 is 2 pieces segment movement in any direction requiring bone graft, includes obtaining autografts, ungrafted unilateral alveolar cleft. So this is the correct code explaining the scenario. So Leaford osteotomy, 2 pieces with bone grafting. So the correct answer is answer D. If you encounter this scenario in a real working world, you have to use the CPT alphabetic index. When you go to the CPT alphabetic index, first you have to search for the main term reconstruction. Here you can see this is the facial reconstruction. So the main search term is reconstruction. So we go to the index and go for the main term reconstruction. There you have to go to the subterms midface. Here you can see with bone graft, without bone graft, forehead advancement. There are 3 subtopics available. So in our case, this is with bone graft. So it will redirect you to the following code series. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer D. Question number 2. A patient is diagnosed with compression fractures of the L2, L3 and L4 vertebrae. The patient agrees to have kyphoplasty. A balloon catheter is inserted in the vertebrae and inflated, restoring the height of the vertebrae. Bone cement is injected in the vertebral space until the whole L4 body is filled. The same procedure is performed on the L2 and L3 levels. The procedure performed bilaterally on the 3 vertebrae. What CPT coding is reported? So there are 4 answers available. Take your CPT code book and find the answer. Okay, here you have to highlight this is compression fractures of the L2, L3 and L4 vertebrae. Procedure done is kyphoplasty using balloon catheter, and the procedure is performed in all the L2, L3 and L4 vertebrae and done bilaterally. Here also you can see the codes are use adjacent codes, so you can use the elimination method to find the answer. I also explained the alphabetic method also. So when you go to the code 22,513, it says percutaneous vertebral augmentation including cavity creation, fracture reduction and bone biopsy included when performed using mechanical device. Example, kyphoplasty, 1 vertebral body, unilateral or bilateral cannulation, inclusive of imaging guidance, thoracic. So up to now, it's a common description for all 3 codes. This is for the thoracic. So here you can see vertebral augmentation, that is called the kyphoplasty. So the procedure is kyphoplasty, cannulation used bilaterally. So this says for thoracic. in our case, L2, L3, L4, that is lumbar vertebra. So this thoracic one is not suitable. Let's go to the next code, lumbar. So lumbar is suitable. And when you see the add-on code 22,515, that says each additional thoracic or lumbar vertebral body lists separately in addition to the code for the primary procedure. So in our case, we have done the kyphoplasty for 3 lumbar vertebrae, L2, L3, L4. So for the first one, you have to use this code, that is 22,514. For the next one, you have to use the 22,515. And the third one, you have to multiply by 2. So the correct answer will be this one, 22,514 and 22,515 into 2. Here you may confuse whether to use the modifier for bilateral procedure. That means the answer C. But read carefully, in the code description it says this code is for unilateral or bilateral cannulation. So all these things, this code includes the unilateral or bilateral both. So the correct answer will be answer B. So here no need for the modifier. If you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So in the CPT alphabetic index, you can directly go to the index term kyphoplasty. It will lead you to the code series 22,513 to 515. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 3. It's a tricky question. I obtained this question from the CPT guidebook. So without looking answer, if you find the answer for this question, you are ready to take the real exam. The question is, a 50-year-old presents to the operating room with the right index trigger finger and left shoulder bursitis. The left shoulder is injected with 1 cc of xylocaine, 1 cc of celestone, and 1 cc of marcaine. An incision was made over the A1 pulley in the right distal transverse palmar crease, about an inch in length. This is taken through skin and subcutaneous tissue. The A1 pulley is identified, released in its entirety. The wound is irrigated with antibiotic saline solution. The subcutaneous tissue is injected with marcaine without epinephrine. The skin is closed with 4-knot ethylone suture. Clean dressing is applied. What are the codes for these procedures? So there are 4 answers available. Take your CPT code and find the answer. If you are able to find the answer, you are competent to take the real exam. So here you have to highlight there are 2 procedures actually. One is for the right index trigger finger and other one for the left shoulder bursitis. For the left shoulder bursitis, the injection is given. You can see the injection is given. And for this trigger finger, incision was made over the A1 pulley. A1 pulley is identified and released its entirety. So there are 2 procedures. So you have to find the codes for both. So let's find the code for the right trigger finger. So here also you can use the elimination method to find the answer quickly in the exam purpose. But in the real working world, you have to use the alphabetic index. So I'll explain both. Let's find the code for the right index trigger finger release. So when you go to the code, 20,552 is injection, single or multiple trigger points. 553 is single or multiple trigger points, 3 or more muscles. 26,055 is tendency incision. But read carefully, you may confuse here. There are incision and injection. So which one given incision and which one given injection, you have to read carefully. So for the right index trigger finger, you can see the first thing, the left shoulder is injected. So for the left shoulder bursitis, injection is given. But for the right index trigger finger, incision was made. So incision here. So when you look at the answer, 552 and 53 is injections. First one is single, second one is multiple. But 20,055 is tendency. So to relieve the right index trigger finger, incision is made. So for the incision, you have to give the answer 26,055. And regarding the modifier, but in this answer, there's no confusion because only one modifier is used, that is F6. So when you go to the cover page of the CPT codebook, you can see the modifiers. So there are modifiers for the eyelids and the fingers. So here, right index finger means second finger because thumb is the first finger and the index is the second finger. So here you have to go, this is right side. So F series, you can see, first it comes from left side, then right. F5 is right hand thumb. F6 right hand second digit. The second digit is the index finger. So F6 is the correct code, but all four answers having the same code, so there's no confusion. So in this case, you can select A and C. So you can eliminate this B and D with the first procedure. So let's check the code for the second procedure. So the second procedure, you can see the answer given here is to A and C we have selected. So A is 20,610. That is arthrocentesis, aspiration or injection, major joint or bursa, example shoulder, hip, knee, subacromial bursa without ultrasound guidance. So in this case, there's nowhere mentioned regarding the ultrasound guidance, so we have to take it as without ultrasound guidance. And the place the injection is left shoulder. So here the injection given is shoulder. So shoulder is included here. So the correct code will be 20,610. Then you have to think about the modifier. So in this case, there are two procedures done. One for the trigger finger, other one for the left shoulder. So two procedures, different anatomical locations. So you have to use the modifier 51 for the multiple procedures. So the correct answer is answer C. So if you encounter this case in a real working scenario, you had to use the CPT alphabetic index. So in the CPT alphabetic index, you can directly find the code for the trigger finger. That is trigger finger repair. Only one code it will mention, that is 26,055. You can go back to the tabular list and confirm the answer. So that is the code for the trigger finger. The injection, you have to go to the main term injection, then go for the subterm joint. So there are codes available. Again, you have to come back to the tabular list and confirm the answer. Once you confirm, the correct code will be 20,610. So the correct answer is answer C. Question number 4. A patient's left eye is damaged beyond repair due to a work injury. The provider fabricates a prosthesis from silicon materials and makes modifications to restore the patient's cosmetic appearance. What CPT code is reported? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight the left eye is damaged and prosthesis from silicon material is inserted. So when you look at the answer, 21,000 adjacent codes are used. So you can use the elimination method for the exam purpose. So let's go to the codes. So once you go to the code, 21,076 is impression and custom preparation, surgical obturator prosthesis, orbital prosthesis. So the 76 is obturator prosthesis, 21,077 is orbital prosthesis. So in our case, the prosthesis is for left eye. Eye means orbital. So eye we can call as orbital. So orbital prosthesis is the correct. So 21,077 is the correct answer. When you look at other answer, 21,008 is definitive obturator prosthesis, that is not suitable. And 21,086 is auricular prosthesis. Auricular means the ear. Orbital means the eye. So the correct answer will be answer D. So if you encounter this case in a real working world, you had to use the alphabetic index. So when you go to the alphabetic index, there you have to search for the term orbital prosthesis. It will lead you to the code this one. So if you search with the main term prosthesis, then you have to search for the subterms, but it will little bit difficult. Here I had to highlight another thing. When you read the code description on the top, it says codes 21,076 to 89 should only be used when the physician or the other qualified healthcare professional actually designs and prepares the prosthesis. In this case, you can see the provider fabricates the prosthesis from silicon material and makes modification to restore the patient's cosmetic appearance. So the code is correctly matching here. Question number 5. In each CPT code series question, you may expect one ICD-10 code as well. So this question is such type. So here, a patient presents to their primary care physician to management of degenerative osteoarthritis in the right wrist. The physician performs an injection of 1 milligram Sinovac into the right wrist joint. What CPT and ICD-10 codes are reported for this encounter? So there are 4 answers available. Take a CPT and ICD-10 code books and find the answer. So here you have to highlight this is degenerative osteoarthritis in the right wrist, injection given on the right wrist. So you can use the elimination method as their adjacent codes are used here. So let's find out the CPT code first. So when you go to the code series, 20,550 is Injection, single tendon sheath or ligament aponeurosis, plantar fascia. 551 is single tendon origin or insertion. 526 is injection therapeutic. Example, local anesthetic corticosteroids for carpal tunnel. 605 is arthrocentesis, aspiration or injection, immediate joint or bursa. Example, temporomandibular, acromioclavicular, wrist, elbow or ankle without ultrasound guidance. 606 is with ultrasound guidance. So in this case, you can see degenerative osteoarthritis, physician performance injection into the right wrist joint. So right wrist joint injection. So the correct code will be 605. You can see the wrist joint also mentioned in the description as well. So 605 will be correct answer for the CPT code. So when you look at the answers, the 605 is only used in answer C. So you can directly go for the answer, but better to confirm with the ICD 10CM code as well. So let's find the ICD 10CM code. So when you go to the code M19.23, that is secondary osteoarthritis wrist. But in our case, you can see the osteoarthritis mentioned as the degenerative. Degenerative one is the primary. If you are confused with that, for using secondary code, it should be mentioned as a secondary. Otherwise, you can go for the primary. So when you go other code, M19.03 is primary osteoarthritis wrist, and the subcode is primary osteoarthritis right wrist. So in our case, right wrist or primary osteoarthritis. So the correct code will be M19.031. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you had to use the alphabetic index of CPT and ICD-10-CM to find the answers. So let's see how to find that. So for the CPT alphabetic index, first you have to go for the search term injection, then go to the subterm joint. So it will lead you to the following code series. Again, come back to the table list and confirm the answers. Once you confirm, it will be answer 20,605. In the ICD-10-CM alphabetic index, first you have to go search for the main term osteoarthritis, then go for the subterm wrist, then go for the subterm primary. It will lead you to the code M19.03. Again, come back to the tabular list and confirm. Once you confirm, the correct code will be M19.031. So the correct answer will be answer C.
Question number 6. A patient sustained a wrist fracture while hiking and a gauntlet cast was applied by the emergency room physician. 1 month later, the patient visits their primary care provider to have the cast removed. What CPT code is reported by the primary care provider? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is a wrist fracture and cast was applied by the emergency room physician and the primary care provider removed the cast. The question here is the code for the primary care provider. So don't mess up with the emergency room physician's procedure. So when you look at the answer, all answers are adjacent codes. So you can use the elimination method to find the answer in the exam. So once you go to the codes, so code 29,700 is removal or bivaling of gauntlet, boot or body cast. 229,705 is full arm or full leg cast. In our case, it's a gauntlet cast. You can see it's a gauntlet cast. Gauntlet cast means the cast applied for the wrist, like glove cast application. It's called the gauntlet cast. So that will be the correct coding here. So the correct answer will be answer B. So if you encounter this case in a real working scenario, you had used the CPT alphabetic index. So in the CPT alphabetic index, first you have to search for the main term here, cast removal. So go to the main term removal, then go to the subterm cast. So it will lead you to the following 3 codes. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B. Chapter 9, CPT 30,000 code series. It includes respiratory and cardiovascular system questions. Question number 1. A 58-year-old patient requires extracorporeal membrane oxygenation, that is ECMO, for acute respiratory syndrome. The cannula insertion is through an open approach via surgical incision in the chest. What CPT codes are reported? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight this is the extracorporeal membrane oxygenation. The cannula incision is through an open approach via surgical incision in the chest. So when you look at the answer, all answers are adjacent answers. So you can use the elimination method for the exam purpose. But in the real time, you can use the alphabetic index method. So I'll explain both. So when you look at the answer, 33,956 is insertion of central cannulae
by sternotomy or thoracotomy 6 years and older. 32,100 is thoracotomy with exploration. So in our case, it is insertion of cannulae, open approach in the chest. So chest including the thoracotomy. So more than 6 years. The patient is 58 years. So this code is ideal, 33,956. So whether you need to you answer B or answer A. When you look at the answer, the 32,100, that is for thoracotomy with exploration, only the thoracotomy procedure. But here, 33,956 include both thoracotomy procedure with the cannula insertion. So you can give the answer B. Also, you can read the additional note that says, do not report 33,955 or 33,956 in conjunction with 33,100 and 39,010. So the additional note also giving you the clue. So the correct answer will be answer B. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So in the CPT alphabetic index, first you have to go for the main index term, that is extracorporeal membrane oxygenation. Then go to the subterms, insertion of cannulae, then go for sternotomy or thoracotomy. It will give following two codes. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B. Question number 2. A patient with a chronic sinus pain and swelling presented to the office for a diagnostic endoscopy of the nasal sinuses. During the procedure, the surgeon excised 2 polyps on the left nasal sinus. What is the correct code for this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight, initially it is done as the diagnostic endoscopy. Then surgeon excised 2 polyps on the left nasal sinus. So when you look at the answers, all answers are adjacent answers. For the exam purpose, you can use the elimination method. Once you go to the codes, you can see 31,231 is nasal endoscopy, diagnostic, unilateral or bilateral. So initially the procedure done as a diagnostic endoscopy. So this code is represent that part. But after that, it is turned into the surgical procedure. So next code is 31,233 is nasal sinus endoscopy, diagnosis with maxillary sinoscopy. So that is not the procedure. 31,235 is with sphenoid sinoscopy. So that is not the procedure. And 31,237 is nasal or sinal endoscopy, surgical with biopsy, polypectomy or debridement separate procedure. So here you have to see, initially it is started as the diagnostic endoscopy, but it is ended as the excision of polyps. So this code represents the whole scenario. So 31,237 is the correct answer. So B and D are the answers which having the 31,237. But when you consider B, you can see 31,231. That is for the diagnosis purpose and this is for the procedure. But keep in mind, when the endoscopy or any scopy is done and the surgery is with that, the surgery is done, you have to code for the final surgery part. No need to code for the separate diagnostic part. So in this scenario, the correct answer will be answer D. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So in the CPT alphabetic index, first you have to go for the main term, that is endoscopy, then go for the subterm nasal sinuses. So it will ask you to see back to the nasal sinuses endoscopy again. So again go to the nasal sinuses, then go to the subterm endoscopy, then you can see the subterm polypectomy. It leads you to the code 31,237. Again go back the table list and confirm the answer. Once you confirm the answer, the correct answer will be answer D. Question number 3. A 40-year-old female in the hospital who has AIDS has been put onto ventilator due to her weakness and dyspnea. The physician suspects she has pneumonia and performs a thoracoscopy. The contents of the chest cavity are inspected with an endoscope and multiple nodules are seen in the right lung and biopsied. Pneumocystis carinii pneumonia is diagnosed. What CPT and ICD-10 codes are reported? So there are 4 answers with CPT and ICD-10 codes. So take your both books and find the answer. So here you have to highlight this is a 40-year-old who has AIDS and the physician has done the thoracoscopy. Multiple nodules are seen in the right lung and biopsies. Also, the patient had the pneumocystis carinii pneumonia and diagnosed. So let's check the CPT codes first. So 32,601 is thoracoscopy diagnostic, that is separate procedure. lungs, pericardial sacs, mediastinal or pleural space without biopsy. But 32606 is mediastinal space with biopsy. 32608 is with diagnostic biopsies on lung nodules or masses unilateral. So here in this case, diagnostic procedure done and the multiple nodules are seen in the right lung and biopsy. So unilaterally biopsy. So the correct code here will be 32,608. That is thoracoscopy diagnostic with diagnostic biopsy of lung nodules. So the correct code will be 32,608. So you can select the answer B and C. Then let's check the ICD-10-CM codes to verify the answer. So when you go to the ICD-10-CM codes, B20 is human immunodeficiency virus disease, that is HIV disease. B59 is pneumocystosis, that is pneumonia due to pneumocystis carinii. Z21 is asymptomatic human immunodeficiency virus infection status. So according to the ICD-10-CM guidelines, if a patient is admitted for an HIV-related condition, the principal diagnosis is B20, followed by additional diagnosis codes for all reported HIV-related conditions. So, for this scenario, pneumocystis carinii fungus causes pneumonia in 8 patients, meeting the guidelines of being an AIDS or HIV-related condition. So, the correct answer will be answer D. So, if you encounter this case in a real working scenario, you have to use the alphabetic index of both CPT and ICD-10-CM. When you go to the CPT alphabetic index, first go to the main term, that is thoracoscopy, then go for the subterm diagnostic, then go for the subterm biopsy, then you'll find the codes and come back to the tabular list and confirm the answer. For the ICD-10-CM, first go to the codes for AIDS, that is B20, then go for the codes pneumocystis carinii pneumonia, that is B59. So the correct answer will be answer B. A 42-year-old female patient presents for a scheduled hematology laboratory test. The healthcare provider obtains a blood sample through the patient's existing peripherally inserted central catheter, that is PICC. Which of the following CPT codes should be reported for this procedure? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight this is hematology laboratory test, blood sample through the patient's existing peripherally inserted central venous catheter. So when you look at the answers, all answers are almost adjacent codes. So you can use the elimination method in the exam. So once you go to the code, 36415 is collection of venous blood in vena puncture. But here that is not the case. 36591 is collection of blood specimen from the completely implantable venous access device. So that's also not the case here. 36592 is collection of blood specimen using established central or peripheral catheter, venous or otherwise specified. 37799 is unlisted procedure, vascular surgery. So in this scenario, the code will be 36592. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you have to use the alphabetic index. So here, first you have to go to the main index, that is collection and processing, then go for the subterm specimen, then go for the subterm venous blood. So it will lead to following 3 codes. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer C. Question number 5. A physician performed a repair of a diaphragmatic hernia on a 15-day-old neonate with the creation of a ventral hernia. What is the correct code for this service? So there are 4 answers available. Take your CPT code book and find the answer. So here, this is a diaphragmatic hernia on a 15-day-old neonate with the creation of ventral hernia. So when you look at the answer, all answers are adjacent codes. So you can use the elimination method to find the answer. So once you look at the codes, 39501 is repair laceration of diaphragm, any approach. 39503 is repair neonatal diaphragmatic hernia with or without chest tube insertion and with or without creation of ventral hernia. So this is exactly matches the scenario. So these type of question we have to be careful. Sometimes the age will be given only as 15 days old boy or girl. So we have to be careful that less than 28 days is neonate. So if it is neonate, the correct code will be 39,503. So the correct answer is answer B. If you encounter this scenario in a real working world, you have to use the CPT alphabetic index. So for the CPT alphabetic index, first go to the main term, that is hernia repair, then go for the subterm diaphragmatic. So it will lead to the following code series. is. Another subterm is neonatal, so it will lead you to the code 39,503. So the correct answer will be answer B. Question number 6. A 38-year-old patient develops progressively worsening hypotension, prompting the need for immediate central venous access for fluid resuscitation. An emergent non-tunneled central venous catheter is inserted into the subclavian vein and secured for medication infusion. Because of the patient's low blood pressure and the anticipated requirement for vasopressor therapy, an arterial line is also placed. The left radial artery is easily palpated and an angiocatheter is inserted into the left wrist. Which CPT code should be reported for this encounter? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is an emergent non-tunnel central venous catheter is inserted into the subclavian vein. That is first procedure. Second procedure is angiocatheter is inserted into the left wrist. So there are 2 procedures. So when you look at the answer, the first answers are adjacent codes for all 4 answers. Also the second choice also adjacent code. So let's check the first code of each answer. So when you go to the code 36555 is insertion of non-tunnel centrally inserted central venous catheter younger than 5 years old. But in our case that is 36. So more than 5 years. So next answer is 36556 is age is 5 years or older. So the first procedure is an emergent non-tunnel central venous catheter. So insertion of non-tunnel central venous catheter more than 5 years. So the correct code will be 36,556. So you can select the answer B as the final answer, but you have to check other codes as well. So let's check the other code. The code 36,620 is arterial catheterization or cannulation for sampling, monitoring or transfusion. Separate procedure percutaneous. So when you look at the second code, the left radial artery is easily palpated and an angiocatheter is inserted into the left wrist. So that is exactly matches the scenario. When you look at the other answer, 36,640 arterial catheterization for prolonged infusion therapy, that is for chemotherapy cut down. But in our case, the correct code will be 36,620, and there are 2 procedures, 2 are different procedures. So this modifier 51 for the multiple procedure. So the correct answer will be answer B. If you want to find the answer using the CPT alphabetic index, first you have to go to the main term, that is central venous catheter placement, then go to the subterm insertion, then go to the subterm center. So it will lead you to the code series 36,556 to 58. Again, come back to the tabular list and confirm the answer. Again, for the second procedure, you have to go for the main term catheterization, then the subterm arterial, then the subterm percutaneous. It will lead you to the code 36,620. Modify 51 for the multiple procedure. So the correct answer will be answer B. So this is the end of the 30,000 series questions. Mock exam 2. CPT 40,000 series questions including digestive system. There are 6 questions. Question number 1. A patient suffering from cirrhosis of the liver presents with a history of coffee ground emesis. The surgeon diagnoses the patient with esophageal gastric varices. 2 days later in the hospital GI lab, the surgeon ligates the varices with bands via an upper GI endoscopy. What CPT and ICD-10 CM codes are reported? So there are 4 answers available with both CPT and ICD-10 CM codes. Take your both books and find the answer. So here you have to highlight patient came with the cirrhosis of liver. A surgeon diagnoses with esophageal gastric varices. Surgeon ligates the varices with bands via an upper GI endoscopy. So when you look at the answers, all answers are adjacent codes, so you can use the elimination methods for the exam purpose. So let's go to the CPT code series. 43,200 is esophagoscopy, flexible transoral diagnostic including collection of specimens. 43,205 is with band ligation of esophageal varices. In our case, you can see the patient with esophageal gastric varices. So they are gastric and esophageal region. Surgeon ligates the varices. So both the esophageal and gastric region. But this code says ligation of esophageal varices. But when you look at the code 43,240 is with band ligation of esophageal or gastric varices. And the previous code of that is esophago-gastroduodenoscopy. So that is for the upper GI endoscopy. Flexible transoral. So it includes both the esophageal and gastric varices. So the correct CPT code will be 43,244. So when you look at the answer, only one code, that is answer B having that code. So you can directly go for that answer, but you have to confirm ICD-10 CM or 100% make sure the answer is correct. So let's go to the ICD-10 CM code. K70.030 is alcoholic cirrhosis of liver without ascites. But K70.60 is unspecified cirrhosis of liver. Because for this cirrhosis, the cause is not specified. So you can't take as alcoholic cirrhosis, just cirrhosis is given. So you have to take this unspecified cirrhosis. So K70.60. And also for the varices, you can see I85.10 is secondary esophageal varices without bleeding. I85.11 for second esophageal varices with bleeding. So in this case, the patient presents with the coffee ground emesis. Coffee ground emesis mean the bleeding. So the other code will be I85.11. So the correct answer will be answer B. So if you encounter this case in a real working scenario, you have to use the alphabetic indexes of both CPT and ICD-10 CM. So when you go for the CPT alphabetic index, first you have to search for the main term esophageal varices, then go for the subterm ligation. It will lead you to the following three codes. Again, come back to the tabular list and confirm the answer. Similarly, for the ICD-10 CM alphabetic index, first you have to go for the cirrhosis. So cirrhotic, it lead you to the code K74.60. And for the varices, when you go to the index of varices, it will lead you to C varix. Again, go back to varix. Here you have to go for the cirrhosis of liver and subterm bleeding. So it gives you the code I85.11. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, correct answer will be answer B. Question number 2. A 46-year-old male with a 20-year history of cigar smoking presents with a suspicious lesion on his lower lip. Due to clinical suspicion of malignancy, the physician performs a shave biopsy of the lower lip. What is the correct CPT code for this procedure? So there are 4 answers available. 2 are 10,000 series, another 2 are 40,000 series. Take your CPT code book and find the answer. So here you have to highlight the patient with the history of cigar smoking, and procedure done is shave biopsy of lower lip. So let's use the elimination method to find the answer. When you go to the code 11,102, that is tangential biopsy of skin. Example, shave, scoop, sorcerize, curate, single lesion. So here is a shave biopsy, single lesion. But to be careful, other than some specified areas, all other parts of the body, you can code this for shave biopsy. That is 11,102. But for some specific regions that is mentioned before this code, you have to be careful to code them. For example, nail, intranasal, lips, vestibule of mouth, tongue, floor of mouth, penis, those kind of areas, the biopsy should be coded with the relevant body system. So here you can see for biopsy of lip, use 40,490. So you can't code this with 10,000 code series. So when you go for 40,490 is biopsy of lip, 40,500 is vermilectomy, lip shave with mucosal advancement. So here you may confuse. This biopsy of lip doesn't mention about the shave biopsy, but here it says as lip shave. So in this case, you have to use this 40,490 biopsy of lip, because here lip shave mentions with mucosal advancement. So it goes deep, and also it not mentioned about the biopsy. So in that case, you had to use 40,490 as the answer. So the correct answer will be answer C. So if you encounter this case in a real working scenario, you had to use the CPT alphabetic index. So first go for the biopsy, that's the main index term, then go to the subterm lip. So you will find 40,490, or else you can search other way. Go to the main term lip, then go to the subterm biopsy. Again, you will find the same code. So the correct answer will be answer C. Question number 3. A 66-year-old female is admitted to the hospital with the diagnosis of stomach cancer. The surgeon performs a total gastrectomy with formation of an intestinal pouch. Due to the spread of the disease, the physician also performs a total en bloc splenectomy. What CPT codes are reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight patient with the stomach cancer. Procedure done is total gastrectomy with the formation of intestinal pouch, and also performs a total en bloc splenectomy. So when you look at the answer, all codes are adjacent codes. There are 2 sets of codes available. So you can use the elimination method to find the answer. So let's find the first code. 43,620 is gastrectomy total with esophagoenterostomy. 621 is Rook's NY reconstruction, but 43,622 is with formation of intestinal pouch anytime. So this procedure says total gastrectomy with formation of intestinal pouch. So the first code will be 43,622. So you can highlight answer A in answer B. So let's check the next code. 38,100 is splenectomy total separate procedure. 101 is partial separate procedure. 3802 is total en bloc for extensive disease in conjunction with other procedure list in addition to code for primary procedure. So here it is not just total splenectomy, it says total en bloc splenectomy. So total en bloc splenectomy is mentioned in the code 36,102. So the correct answer will be B, 43,622 and 38,102. So in this case, you may confuse whether to use the modifier 51 or not. Here you can see the code is an additional code. If it is an additional code, you can't use the modifier, you just use the code with the primary code. So this is the primary code and this is the add-on code. If says it's just a splenectomy, then you can code 43,622 and 38,100 and with the modifier 51. If you use this code, you can use the modifier, but this is the add-on code, so here no need for use modifier. So the correct answer will be answer B. So if you encounter this case in a real working scenario, you have to use the alphabetic index. So when you go to the CPT alphabetic index, first go for the main procedure gastrectomy. So the main index is gastrectomy, then go for the subterm total. It will lead you to the following code series. Again, come back the tabular list and confirm the answer. Similarly, for splenectomy, for total it says 38,100 and for en bloc it says 38,102. Again, come back the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B. Question number 4. A patient with a history of a radical right hemicolectomy for ascending colon carcinoma presents for a scheduled follow-up colonoscopy. The physician inserts a video colonoscope and advances it beyond the splenic flexure. During the procedure, the patient experiences a sudden drop in the blood pressure. Due to the hemodynamic instability, the physician elects to terminate the procedure for the patient's safety and withdraws the scope. What is the correct CPT code reported? So there are 4 answers available. Take your CPT code book and find the answer. Here you have to highlight, this is a scheduled follow-up visit for the colonoscopy. Physician inserts a video colonoscope and partially terminate the procedure due to some issues in the hemodynamic status of the patient. So when you look at the answer, all answers are adjacent codes, so you can use the elimination method in the exam. So once you directly go to the code, 45,378 is colonoscopy flexible diagnostic including collection of specimen by washing when performed, separate procedure. So that is the case here. Here colonoscopy is done for the diagnostic purpose. When you look at other answer, 45,391 is with endoscopic ultrasound examination, though that is not the case here. 45,395 is laparoscopy surgical, but here is a colonoscopy, so not possible. 44,360 is small intestinal endoscopy, so that also not possible here. So here the correct code will be 45,378. When you look at the modifier 52 and 53, 52 is for reduced services, 53 is discontinued procedure. In this case, the procedure is discontinued due to the issues with the patient status. So correct modifier will be 53. So the correct answer will be answer A, that is 45,378 with the modifier 53. So if you use the CPT alphabetic index, first you have to go to the main index, that is colonoscopy. Then the subterm is flexible, it is for diagnostic. So it will lead you to the code 45,378. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer A. Question number 5, it's a straightforward one. A patient underwent a laparoscopic cholecystectomy, including intraoperative cholangiography. How should this procedure be reported? So there are 4 codes available. Take your CPT code book and find the answer. So here the procedure is laparoscopic cholecystectomy with cholangiography. So when you look at the answer, all answers are adjacent codes, so you can use the elimination method. When you look at the codes, 47,600 is cholecystectomy, but here cholecystectomy including cholangiography. 47,605 with cholangiography. So cholecystectomy with cholangiography. So you may think that 47,605 is the correct answer, but keep in mind this procedure is laparoscopic one. Here code doesn't mention as a laparoscopy. So it may be the open surgical procedure. So laparoscopic one, you have to go the other codes. 47,562 is laparoscopy surgical cholecystectomy only here. 47,563 is cholecystectomy with cholangiography. So laparoscopy surgical cholecystectomy with cholangiography. So the correct answer will be answer C. So in this case, you have to be very careful whether to select answer B or answer C. Answer B for just cholecystectomy with cholangiography, but answer C is for laparoscopic surgery for cholecystectomy and cholangiography. If you encounter this case in a real working world, you have to use the CPT alphabetic index. So in the CPT alphabetic index, first you have to search for the main term, that is cholecystectomy, then subterm any method here with cholangiography. So there are 3 codes available. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer C. Question number 6. A 50-year-old male presses to the operating room for open surgery on a recurrent incarcerated incisional hernia repair with insertion of a prosthetic mesh. The size of the hernia is 12 centimeter. What CPT code was reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is the recurrent incarcerated incisional hernia, repair with the insertion of prosthetic mesh, and the hernia size is 12 centimeter. So in the answer, adjacent codes are used here. So you can use the elimination method to find the answer. So directly go to the codes. So when you go to the code directly, 49,630 is repair of anterior abdominal hernia, epigastric, incisional, ventral, umbilical, any approach, recurrent, including implant of mesh or other processes when performed. Total length defect is less than 30 centimeter, reducible. In our case, 12 centimeter incarcerated. So other code is 49,608 is greater than 10 centimeter, incarcerated or strangulated. So all the conditions are fulfilled by this code. Recurrent. So you can see this is recurrent, incarcerated, incisional hernia, and more than 10 centimeter, that is 12 centimeter. So this answer will be correct. When you check other codes, 549,591 is repair of anterior abdominal hernia, initial including implantation of mesh. So here this initial hernia, but in our case it's a recurrent one. So recurrent one is coded in this code. When you check 15,778, that is implantation of absorbable mesh. So that's a separate procedure. But these codes are including mesh also. So the correct answer will be answer D, that is 49,618. This code you have to read with the previous code. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. So in the CPT alphabetic index, first go to the main term hernia repair, then go to the subterm anterior abdominal wall. There are 2 types, initial and recurrent. Our case is recurrent. So it will lead you to the following series of codes. Again, come back to the tabular list and read these codes from 49,613 to 618. Then you can find the answer. D is correct. That is 49,618. So this is the end of this part. Chapter 11, CPT 50,000 series. This series includes the surgical procedures to the urinary system, male and female reproductive system, and maternity care and delivery. So there are 6 questions. Let's start. Question number 1. An 87-year-old male patient in a rehab hospital status post-hip transplant is having trouble voiding. After his last voiding, the physician measured his bladder capacity using a non-imaging ultrasound device. How should you code for this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight the patient having trouble in voiding. Physician measured his bladder capacity using a non-imaging ultrasound device. When you look at the answers, all answers are adjacent codes, so you can use the elimination method. So once you go to the code, 51,741 is complex uroflowmetry, example calibrated electronic equipment. But here that is not the case. 51,798 is measurement of post-voiding residual urine and or bladder capacity by ultrasound non-imaging. That is exactly the code. Here you can see ultrasound non-imaging device. When you look at other answer, 51,792 is stimulus evoked response. So that is not the case here. So the correct answer will be answer B. So here you may get confused whether to use the modifier 50 or not. The answer B and C are the same, but with the modifier. So the modifier 50 is for the bilateral procedure. But here the surgery done on the bladder. Bladder is single bladder, only one in the middle part. So there's no bilateral. So you no need to use the bilateral code. So the correct answer will be answer B. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. So in the CPT alphabetic index, you can find the answer in two ways. One is you can go to the main index of urodynamic test, then go to the bladder capacity, then go for the ultrasound. It will lead you to the code. Or else, first you can go to the procedure, main procedure, that is ultrasound. So go to the main index ultrasound, then go to the subterm bladder, and it have the sub term as non-imaging capacity measurement that leads you to the code 51798. Once you confirm in the tabular list, the correct answer will be answer B. Question number 2. The patient presents with a right-sided ureteral calculus. In the operating room, the physician performs a cystoscopy with ureteroscopy to remove the stone. Which CPT code should be reported for this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this right-sided ureteral calculus. So one-sided, and the physician performs cystoscopy with ureteroscopy to remove the stone. So when you look at the answer, all answers are adjacent codes. You have to be careful. This kind of procedures, you have to use the bundled code. You can see there are 2 scopes: cystoscope, ureteroscope, and the removal of stone. So there are bundled codes. So rather than going for the single code, you have to look at the bundle code. So let's go to the codes. 51065, that is cystotomy. But here this is not a cystotomy. This is a stone removal with the cystoureteroscopy. So this is not the case. 52310 is cystoureteroscopy with removal of foreign body, calculus or ureteral stain from the urethra or bladder. Separate procedure, simple. So here it says cystoureteroscopy and not the ureteroscopy. So when you go to the other answer, 52351 is cystoureteroscopy with ureteroscopy, endopiloscopy, diagnostic. But in our case, this is therapeutic. We are removing the stone. So this is not the case. When you look at other answer, 52352 is cystoureteroscopy with ureteroscopy. So you have to be careful the term. Ureter is different, urethra is different. This is the cystoureteroscopy, that is urine output with the bladder. This is the ureter coming from the kidney to bladder. So cystoureteroscopy with ureteroscopy with removal or manipulation of calculus. So calculus removal is mentioned here. When you look at other answer D 353 is with lithotripsy. Here there's no lithotripsy, only the removal. So correct code will be 52352. That is answer C. So if you encounter this case in a real working scenario, you have to use the alphabetic index. When you go for the alphabetic index, you have to search the main term, that is calculus, then the subterm removal. Here the stone is removed in the ureter region. You can see the right-sided ureteral calculus. So go to the subterm ureter. So there are many codes available. You have to come back to the tabular list and confirm the answer. Once you confirm, the correct code will be answer C. Question number 3. A neonatal male has an elective circumcision before home discharge from the newborn nursery. The physician uses a ring block for the local anesthetic and the foreskin is placed over the glands. A clamp is selected for the size of the glands and a constricting circular ring is placed over the foreskin to compress and devascularize the foreskin. The devascularized foreskin is excised with the scalpel, the ring device is removed and the penis is dressed. Which CPT code is reported? So there are 4 answers available. So this is the procedure of circumcision. Take your CPT code book and find the answer. So here you have to highlight, this is a neonate with elective circumcision. So here the anesthesia method is a ring block of anesthesia used and clamp is selected for the size of the glands and the devascularized foreskin is excised with the scalpel. The ring device is removed and the penis is stressed. So you can see all answers are adjacent codes. So you can use the elimination method in the exam. So when you go to the code A, that is 5450, that is circumcision using clamp or other device with regional, dorsal, penile or ring block. So this is the case here. You can see circumcision is done using the clamp and the dorsal penile or the ring block. So here you can see the ring block for the local anesthesia. Here the ring block is used. So when you look at the answer B is with the modifier 52. When you look below the code 5450, it says report 5450 with modifier 52 when performed without dorsal penile or ring block. So if it is done without dorsal penile or the ring block, you can code with the modifier. But in this case, it used with the ring block, so you can code with the A. So when you look at other answer, 5460 is circumcision, surgical excision other than clamp decisal or dorsal slit, neonate days of age or less. Here it mentions the neonate. When you look at other answer, it says older than 28 days. But we had to be careful. This code 5450 is not mentioning whether it's a neonate or adult. It's a common code. So its common code is suitable for all age group. So if it is a circumcision done without the clamp device or dorsal slit, then you have to be considered whether it's a neonate or the adult. If it is neonate, you have to use this one. Adult, you can use this one. But in this case, it's done using the clamp or other device, so you have to go with the code 5450. So correct answer is answer A. So if you encounter this case in a real working world, you have to use the alphabetic index. So in the alphabetic index, first you have to go for the main term, that is circumcision, then go for the subterm surgical excision. This is a neonate. So when you go to the neonate, it says 5450 and 5460. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer A. Question number 4. A 55-year-old female presents with stress urinary incontinence documented as secondary to intrinsic sphincter deficiency. The surgeon performs a formal vaginal sling procedure. A mid-urethral incision is made and dissected laterally to the uretero-pelvic ligament. The synthetic sling is positioned at the uretrovesical junction and the ends are brought through a suprapubic incision. To ensure safety, the cystourethroskopy is performed, confirming no bladder or urethral penetration occurred during the placement. The tension is adjusted using the hemostat to allow for a tension-free support. Which CPT code should be reported? So there are 4 answers available. Take your CPT code book and find the answer. So when you look at the question, it seems to be very bigger one, but when you highlight the important part, it's a small question. You can see this is a 55-year-old female with the stress urinary incontinence, secondary to intrinsic sphincter deficiency. Surgeon performs a formal vaginal sling procedure. Formal vaginal sling procedure is the open procedure. You can see the procedure is mentioned here, the detailed procedure mentioned here, but no need to worry about that. And also a cystourethroskopy is performed with the procedure. So let's find the answer using the elimination method. So once you go to the code 57287, that is removal or revision of sling for stress incontinence. But here this is not removal, here is the insertion. So when you look at other answer 57288, that is sling operation for stress incontinence, example fascia or synthetic. So this is the correct case here. When you look at other code 52,000, that is cystourethroskopy separate procedure. So in this scenario, this is not separate procedure. This is an internal part with the procedure. So you don't need to code for this cystourethroskopy separately. When you look at the other answer here, very important, 51992 is sling operation for stress incontinence. That's the same code. You can see 57287 and 51992. Both are seen to be same, but read the bracket item here. It says for open sling operation for stress incontinence, use 57288. So this is for the non-open, that's a laparoscopic or any other ureteroscopic procedure. You can code this one. For the open procedure, you had to code for 57288. So how to find this is open procedure? So I have highlighted on the important part of the question here. So let's go back. Here you can see performs a formal vaginal sling procedure. Formal means the open procedure. But if you have doubt, you can read the procedure notes here. You can see a mid-urethral incision made and dissected laterally to the uretero-pelvic ligament. So it's an open procedure. The procedure is described here. So you have to be careful in this code, these two. So here the correct answer will be answer B. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. In the CPT alphabetic index, the procedure here is sling operation. So go for the main index term, sling operation. The sling operation is done for the urinary incontinence or the stress incontinence. You can see stress urinary incontinence. So that you can see stress incontinence. Following codes are here. So again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B. Question number 5. A pregnant patient at 32 weeks gestation with the diagnosis of polyhydramnios present for a therapeutic amniocentesis. After administration of local anesthesia and under continuous ultrasound guidance, the physician percutaneously inserts a needle into the amniotic sac. The therapeutic drainage system is utilized to remove a significant volume, that is 1800 cc of amniotic fluid, to reduce the patient's symptoms. The needle is removed and the fetus is monitored post-procedure. Which CPT code should be reported for this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So
So here you have to highlight the patient coming with the diagnosis of polyhydramnios, present for the therapeutic amniocentesis, local anesthesia and continuous ultrasound guidance. Physician percutaneously inserts a needle into the amniotic sac. Therapeutic drainage system is utilized to remove a significant amount of amniotic fluid. So here the procedure amniocentesis is done using the ultrasound guidance. That is the summary. So let's use the elimination method to find the answer because all the codes are addition codes. So when you go to the code 59,000, that is amniocentesis diagnostic. But in your case, the amniocentesis is for therapeutic. So 59,001 is therapeutic amniotic fluid reduction includes ultrasound guidance. So this is the correct code for this procedure. When you look at the codes 76946, that is ultrasound guidance for amniocentesis, imaging supervision and interpretation. So if it is a diagnostic procedure with ultrasound guidance and the physician done the imaging supervision and the interpretation, then you have to code with the 59,000 with 76,946. But in this case, it is therapeutic procedure and the ultrasound is included in the code 59,001. So the correct answer will be answer C. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. In the CPT alphabetic index, you have to search for the main term, that is amniocentesis, and the subterm therapeutic. In the therapeutic, you can see amniotic fluid reduction, that is 59,001. Go back to the tabular list and confirm the answer. Once you confirm, the correct answer is answer C.
Question number 6. A female patient with extensive invasive bladder cancer presents for surgical intervention. The surgeon performs a total cystectomy. During the same operative session, a bilateral pelvic lymphadenectomy is completed, including the external iliac, hypogastric, and obturator nodes. To manage urinary output, the surgeon creates a ureteroideal conduit, that is an ileal loop. So, which CPT code should be reported for this procedure? So, there are 4 answers available. Take your CPT code book and find the answer. So, here you have to highlight this is a female patient with extensive invasive bladder cancer. The surgeon performs a total cystectomy. Cystectomy means the removal of bladder, and the bilateral pelvic lymphadenectomy, that is removal of the lymph nodes. And also, a surgeon creates a ureteroideal conduit. So when you look at the answer, there are multiple codes used and those codes are different locations. So if you use the elimination method, it will take some time to find the correct code. So in this type of question, better to use the CPT alphabetic index to find the answer quickly. But for the learning purpose, we'll do the both method. So when you go to the code, 51570 is cystectomy complete separate procedure. So that is one part included there. 51575 is with bilateral pelvic lymphadenectomy, including external iliac, hypogastric, and obturator nodes. So parts of the procedure is included in this both codes. One is for the cystectomy, removal of bladder. Other is pelvic lymphadenectomy, removal of lymph nodes. So other part is creation of ureteroideal conduit. So when you look at other code, 5820 is ureteroideal conduit, including intestinal anastomosis operation. So these 3 codes are separately indicate the procedure, but you have to be careful is there any bundle code to indicate all these procedures. Let's go to other code. 38770 is pelvic lymphadenectomy, that is a single procedure here. 51590 is cystectomy complete with ureterolateral conduit, sigmoid bladder including intestinal anastomosis. 51595 is with bilateral pelvic lymphadenectomy. So this code 51595 is including all 3 procedures. This is a continuation of code 590. You have to read this code 51595 as cystectomy complete with ureteroideal conduit with bilateral pelvic lymphadenectomy. So all 3 parts are included in this code. So the correct answer will be answer C. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. So in the CPT alphabetic index, the main index term is cystectomy. So go to the main index cystectomy, then it is a complete procedure, and the subterms with bilateral pelvic lymphadenectomy. So you can see following codes are available. Again, come back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. CPT 60,000 code series. In this code series, we will see the questions on nervous system, eye adnexia, and auditory system. Question number 1. A single bolus of procaine solution is injected into a vagus nerve of diaphragm to treat a patient in the hospital ER for interrectal hiccups. Provide the procedure and diagnosis codes. So there are CPT and ICD-10 CM codes are available. Take your both books and find the answer. So here you have to highlight this is a procaine solution is injected into the vagus nerve and the patient with the interactable hiccups. When you look at the answer, first you have the ICD-10 CM codes, then the CPT code. So let's find the ICD-10 CM code. So we'll find the answer using the elimination method as well as the alphabetic index method. So when you look at ICD-10 CM codes, you can see there are only two codes available. So let's check directly the codes. So when you go to the code, F45.8 is other somatoform disorders. Then R06.6 is hiccup. You had to read the exclusion note also. It says excludes psychogenic hiccup. So here it's a neurogenic hiccup because the vagus nerve we are injecting to treat the hiccups. So it's a neurogenic. So the correct ICD-10 CM code will be R06.6. When you look at the CPT codes, all codes are adjacent codes. So you can use the elimination method here also. So once you take the code 64,400, that is injection anesthetic agents or steroid trigeminal nerve each branch. So here this procaine is the anesthetic agent, but here we are injecting to the vagus nerve. But here it says trigeminal nerve or each branch of trigeminal nerve includes ophthalmic, maxillary and mandibular. But that is not the case here. When you look at the code 64,408 is vagus nerve. So that's the correct answer. When you check other codes, injection anesthetic agent, saphenophyllotine ganglion, but that is not the case here. So here the ICD-10 CM is R06.6 and the CPT code is 64,408. So the correct answer will be answer B. If you encounter this case in a real working scenario, you have to use the alphabetic index of both CPT and ICD-10 CM. So when you use the alphabetic index of ICD-10 CM, you can directly go for the hiccup or hiccup. There it will lead you to the code R06.6. Again, come back the tabular list and confirm the answer. Similarly, once you go to the CPT alphabetic index, here it's deal with the vagus nerve. So you can go for the main index term vagus nerve, then the subterm injection, then anesthetic. It is anesthetic or steroid, both are leading to 64,408. So the correct answer will be answer B. Question number 2. A surgeon performs an open carpal tunnel release on a 35-year-old patient. The surgeon makes an incision in the palm and cuts the transverse carpal ligament to relieve pressure on the median nerve. The wound is then closed in layers. So which CPT code should be used for this surgery? So there are 4 CPT codes available. Take your CPT code book and find the answer. So here you have to highlight this is the open carpal tunnel release and cuts the transverse carpal ligament, so to relieve the pressure on the median nerve. So once you look at the answer, all answers are adjacent answers, so you can use elimination methods for the examination purpose. So once you go for the code, 64,702 is neuroplasty digital 1 or both same digit. 64,704 is nerve of the hand or foot. When you go for the other code, 64,708 is neuroplasty major peripheral nerve, arm or leg open other than specified. 716 is neuroplasty transposition cranial nerve. 719 is ulnar nerve at wrist. 721 is median nerve at carpal tunnel. So you have to read this code as neuroplasty or transposition median nerve at carpal tunnel. So the correct answer will be answer D. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. Once you go to the CPT alphabetic index, here you can directly go for the index term median nerve compression. The subterm is carpal tunnel syndromes. It will lead you to the code 64,721. Or else you can go for the main term syndromes, then go for the subterm carpal tunnel, then go for the decompression. It will lead you to the code 64,721. So the correct answer will be answer D. Question number 3. A patient undergoes a surgical procedure on the thyroid gland. After the patient is anesthetized, the surgeon makes an incision in the neck, separates the muscles, and completely removes the right thyroid globe. No tumor is found. The incision is closed in layers. What is the correct CPT code for this procedure? So there are 4 answers available. So take your CPT code book and find the answer. So here you have to highlight in this surgery completely removes the right thyroid lobe. There's no tumor found. So when you look at the answer, all answers are adjacent codes. So you can use the elimination method in the exam. So once you go to the code 60,210, it says partial thyroid lobectomy, unilateral. But in our case, completely remove the right thyroid lobe. So our case is complete lobectomy, one side. So this is not possible. When you look at other answer, 60,220 is total thyroid lobectomy, unilateral with or without its splenectomy. So that is the case here. Also, there's no tumor involved. When you look at other answers, thyroidectomy, total or subtotal for malignancy. So if there's a malignancy available, you have to go for this code. But there's no malignant, only the one lobe is removed. So you can use the code 60,220 and you have to use the modifier RT, right, for the unilateral one side. So the correct answer will be answer B. If you encounter this case in a real working scenario, you have to use the CPT alphabetic index. Once you go for the CPT alphabetic index, the index term will be thyroidectomy. In the thyroidectomy, you can see partial, secondary, total. So our case is partial. So once you go for the partial, it will lead you to the code series of 60,210 to 225. Again, come back the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be answer B. Question number 4. A physician utilized a laser and neuroendoscopic guidance to create a duct from the third lateral ventricle to the cisterna magna as a treatment for hydrocephalus. What is the correct code for this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is a laser and neuroendoscopic guidance to create a duct from the third lateral ventricles to the cisterna magna for the treating of hydrocephalus. So here we are removing the cerebrospinal fluid. So once you look at the answer, all answers are adjacent code. So you can use the elimination method in the exam. So once you go to the code directly, 62,180 is ventricular cisternotomy. That is simple. When you go to the 62,200 is ventricular cisternotomy, third ventricle. So our case is third ventricle, but it says the additional items are available down. So once you go for the other answers, 62,201 is stereotactic neuroendoscopic method. Yes, in our case, you can see it's a neuroendoscopic method. So the correct answer will be answer C, 62,201. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. Once you go for the CPT alphabetic index, you can directly go for the index term ventricular cisternostomy. So it will lead you to the following 3 codes. Again, come back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 5. An enteropian repair is performed on the left lower eyelid, in which undermining was performed with scissors of the inferior lid and inferior temporal region. Deep sutures were used to separate the eyelid margin outwardly, along with stripping the lateral tarsus to provide firm approximation of the lower lid to the globe. The correct CPT codes here. So there are 4 answers available with modifiers. Take your CPT code book and find the answer. So here you have to highlight this is enteropian repair, left lower eyelid, stripping the lateral tarsus to provide firm approximation of the lower eyelid to globe. So here you have to be careful. Term like entropian and ectropian. So in the eyelid, you can see in the picture, this is the entropian and this is the ectropian. The entropian is it's an eyelid condition where the eyelid turns inward. So entropian is eyelid turns inward, extropian is eyelid turned outward. So in our case, this is entropian. So when you look at the answer, all answers are adjacent codes available. So let's use the elimination method. Once you go for the code 67,914, it says repair of ectropian suture, but in our case that is entropian. 67,917 is extensive, so ectropian extensive, but in our case entropian. So let's go other answer. 67,921 repair of entropian suture. 67,924 is extensive. Example, tarsal strip or capsulopalpebral fascia repairs operation. So in our case, the lateral tarsal is involved. So the correct code will be 67,924. So once you look at the modifier, so in this case, if you are dealing with the eyelid, you have to use the modifier, HCPCS modifier that is available in the front cover of CPT code book. You can see E1 for upper lid, E2 for lower lid. So in our case, left lower eyelid. So left lower eyelid, you can see E2, that is left lower eyelid. So the correct code will be 67,924 E2, that is answer D. If you encounter this case in a real working world, you have to use the CPT alphabetic index. Once you go for the CPT alphabetic index, you can directly go for the index term entropy and then go for the subterms repair. It will lead you to the following code series. Again, come back to the tabular list and confirm the answer. Once you confirm the answer, the correct code will be answer D. Final question of the 60,000 code series, question number 6. A 2-year-old child is brought to the emergency department because she is crying and pulling at her ear. The physician discovers a small plastic toy stuck in the child's outer ear canal. The doctor successfully removes the object using forceps while the child is awake. Which CPT code should be reported for this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this procedure done in the emergency department. A small plastic toy is stuck in the child's outer ear canal while child is awake means there's no general anesthesia used here. So when you look at the answer, all answers are adjacent codes, so you can use the elimination method. So let's go the codes. 69,105 is biopsy external auditory canal, but here is foreign body removal, so that's not possible. 69,110 is excision external ear canal, so that's not. 69,200 is removal of foreign body from external auditory canal without general anesthesia. Oh, that is the case here because the child is awake, so there's no general anesthesia involved. 205 is with general anesthesia. So in our case, the anesthesia not involved. So the correct code will be 69,200. That is answer C. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. So here the main index term is removal. So go for the main term removal, then go for the subterm foreign body, then other subterm is auditory canal, and the final subterm is external. So it will lead you to the code series. Come back to the tabular list and confirm the answer. Once you confirm, the correct code will be 69,200. That is answer C.
AAPC CPC Mock Exam 2 CPT Radiology series. There are 6 questions.
Question number 1. A patient in her second trimester of pregnancy is referred for a fetal echocardiogram due to a suspected congenital heart defect. The physician performs the procedure in real time, providing 2D image documentation and M-mode recording to assess the fetal heart structure and function. Which CPT code should be reported for this service? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is the second trimester of pregnancy. Came for the fetal echocardiogram. Physician providing 2D image documentation and M-mode recording. So when you look at the answer, all answers are adjacent codes. So you can use the elimination method for the exam purpose. So when you go to the code 76820, that is Doppler velocitometry. So that is not the case here. 76825 is echocardiography, fetal cardiovascular system, real time with image documentation, that is 2D with or without M-mode recording. So that is the exactly scenario here. And you have to be careful. There's another continuation code. So here you can see 768266 follow up or repeat study. So you have to make sure this is the initial encounter or the follow-up. So when you read the question again, a patient in her second trimester of pregnancy is referred for a fetal echocardiogram. So patient is referred. So that is the first encounter. So the correct code will be 76825. That is answer B. If you encounter this case in real working scenario, you have to use the CPT alphabetic index. The CPT alphabetic index, the main index term is echocardiography. Once you go there, the subterm is congenital heart anomaly and fetal. So it will lead you to the code 76825 and 826. Again, come back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 2. A 55-year-old male with a family history of premature coronary artery disease presents for a screening evaluation. The physician orders a CT of the heart without the contrast material. The primary objective is to perform a quantitative assessment of coronary artery calcium, that is calcium scoring, to risk stratify the patient. What CPT code should be reported for this service? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight the encounter is for CT of the heart without contrast material and the quantitative assessment of coronary artery calcium scoring. So when you look at the answers, all answers are adjacent codes, so you can use the elimination method. So once you go to the code 75571, that is computer tomography, that is CT heart without contrast material with quantitative evaluation of coronary calcium. So that is exactly scenario here. So no need for other codes. You can see other code is computer tomography That is for cardiac morphology 3D image. So those are not suitable here. So the correct answer will be answer A. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. Once you go for the CPT alphabetic index, first you have to search for the main term CT scan, then for the subterm heart, then for the coronary calcium. So that is lead you to the code 75571. Again, come back the tabular list and confirm the answer. Once you confirm, the correct answer will be answer A. Question number 3. A 58-year-old patient with suspected congestive heart failure is scheduled for diagnostic imaging. The physician performs a single planar stress cardiac blood pool imaging study. The procedure includes gated equilibrium, evaluation of wall motion, and calculation of the ejection fraction. The following the primary study, the physician also performs a first pass technique at rest to measure the right ventricular ejection fraction. Which CPT code should be reported with this encounter? So there are multiple codes available. Take your CPT code book and find the answer. So here you have to highlight this is a diagnostic imaging. So physician performs single planar stress cardiac blood pool imaging study. The procedure includes gated equilibrium, evaluation of wall motion, and calculation of the ejection fraction. And also the follow-up study, that is following the primary study, physician also performs first pass technique at rest to measure the right ventricular ejection fraction. But when you look at the answer, you can see the first code is 78472 and 73 and 481, and second code is almost similar. So you can use the elimination method for the exam purpose. So once you go to the code 78472, that says cardiac blood pool imaging, gated equilibrium, planar single study at rest or stress, wall motion study plus ejection fraction with or without additional quantitative processing. So that is the case here. So the first code will be 78472. In the code description within bracket, it says for assessment of right ventricular ejection fraction by first pass technique, use 78496. So once you go to the 78496, that is the secondary procedure, it says cardiac blood pool imaging, gated equilibrium, single study at rest with right ventricular ejection fraction by first pass technique. So when you read the secondary here, following the primary study, the physician also performs a first pass technique at rest to measure the right ventricular ejection fraction. So that is the case here. So you have to use both code in conjunction. So the correct answer will be answer A. That is 78472 and 78496. So if you encounter this case in the real working world, you have to use the CPT alphabetic index. In the CPT alphabetic index, the procedure here is blood pool imaging. You can see cardiac blood pool imaging study. So blood pool imaging, that is cardiac subterm. And the first pass, you can go for this code series, and the gated equilibrium, you can go for this series. So again, you have to come back the tabular list and confirm the answer. Once you confirm the answer, the correct code will be answer A. Question number 4. The radiation oncologist provides clinical management for a patient undergoing treatment for small cell lung cancer. During the session, the physician performs the following: reviews the patient's port films, oversees the delivery of 6 treatments, that is fractions of 18 MeV external beam radiation. So which CPT code should be reported for the physician's professional services? Though there are 4 answers available, take your CPT code book and find the answer. So here you have to highlight patient came with the small cell lung cancer, and physician oversees the delivery of 6 treatments, that is fractions of 18 MeV external beam radiation. So when you look at the answer, all answers are adjacent codes, so you can use the elimination method. So once you go to the code, 77402 is radiation treatment delivery more than 1 MeV. Simple. So this is more than 1 MeV, that is 18 MeV, but that is not simple. When you go to the other code, 77385 is intensity modulated radiation treatment delivery. So that is not the case here. And 77386 is complex. So 77427 is radiation treatment management 5 treatments. So in this case, it is 6 treatments, but it says 5 treatments. Other code is 77435, that is stereotactic body radiation therapy. That is not the case here. So the more suitable answer here is 77427, but it says 5 treatments, but in our case, it says 6 treatments. Anyway, you have to code that code, that is C, 77427. The answer is C. The reason is when you read the code description in the CPT code book, you can see the radiation treatment management. The radiation treatment management is reported in units of 5 fractions or treatment sessions. 1 or 2 fractions beyond a multiple of 5 at the end of a course of treatment are not reported separately. So here 6, that is only one additional fraction. So that is not reported separately. So the correct coding will be 77427. So the correct answer is answer C. If you encounter this case in the real working world, you had used the CPT alphabetic index. In the CPT alphabetic index, first you have to search for the main term radiation therapy, then the subterm treatment management, then the subterm weekly. Again, it will lead to the code series. Come back and confirm the answer with tabular list. So correct answer will be answer C. Question number 5. A female patient is evaluated in the clinic 48 hours after a physical assault. She reports right-sided periorbital pain and significant nasal airway obstruction. Physical examination reveals a visible deformity of the midface. To assess for possible fractures, the physician orders a radiologic examination of the facial bones. The imaging technician performs a Waters view and a lateral view. What is the appropriate CPT code for this radiological service? So there are 4 answers available. Take your CPT code book and find the answer. Even though the description says more detail, we only need to highlight this is a radiologic examination of the facial bones. There are 2 views. One is the Waters view, other one is the lateral view. So when you look at the answer, all answers are adjacent code, so you can use the elimination method for the exam purpose. Once you go to the code 7486, that is computer tomography. Here it's X-ray, so that's not the case here. 7220 is radiology examination, sinuses, parasinal, complete, minimum of 3 views. Here we have only 2 views, Waters view and the lateral view, so that's not the case. 7140 is radiology examination, facial bones less than 3 views, so this is the correct here. 7150 is complete, minimum of 3 views. So here 2 views, so less than 3. So the correct code will be 7140. So the correct answer is answer D. If you encounter this case in real working world, you had used the CPT alphabetic index. The CPT alphabetic index, first main term is X-ray, then go to the subterms, facial bones. It will lead you to the code series 7140 to 150. Again, come back and confirm the answer. Once you confirm, the correct answer will be answer D. Question number 6. A 40-year-old female is referred to the radiologist suite for a diagnostic evaluation of the renal parenchyma and collecting system. The radiologist performs a biphasic infusion urography, that is bolus technique, to enhance the visualization of kidney tissue and identify potential small lesions. Nephrotomography is performed as a part of the same imaging session. Which CPT code should be reported for this radiologic procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is a biphasic infusion urography and nephrotomography is performed as a part of the same imaging session. Once you look at the answer, all answers are adjacent codes, so you can use the elimination method for the exam purpose. So once you go to the code 74425, that is urography, antegrade, radiological supervision and interpretation. That is not the case here. 74485 is dilatation of ureter or urethra. That is not the case here. 74410 is urography, infusion, drip techniques, and bolus technique. So here it is a bolus technique. So that's a correct code. And it says there's a continuation code available, semicolon here. So 74415 is with nephrotography. So this procedure includes the nephrotography. So the correct code will be 74415. So the correct answer is answer C. So if you encounter this case in real working world, you have to use the CPT alphabetic index. The procedure is a urography. The main search term is urography and the subterm is infusion or with nephrotography. So both ways you can search here. So once you go back to the tabular list, you can confirm the answer 74415. So this is the end of radiology question series. Chapter 14, Pathology and Laboratory series. There are 6 questions. Question number 1. A physician utilizes automated equipment to perform a lipid panel consisting of HDL, total serum cholesterol, and triglycerides, along with the quantitative glucose test. Which of the following CPT code sets accurately report these services? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this First investigation done is lipid panel consisting of HDL, total serum cholesterol, and triglycerides, along with quantitative glucose test. So once you look at the answers are scattered. So there are different kinds of answer. So rather than going for the elimination method, you can use the alphabetic index to find the answer easily. So once you go to the alphabetic index, first for lipid panel, go to the main term lipids, then go to the subterm panel. It will lead you to the code 80061. Similarly, you can find the same thing using organ or disease oriented panel, again subterm lipid panel. So both ways you can find the code. So 80,061, again go by the tabular list and confirm the answer. So once you go to the tabular list, 80,061 says lipid panel. This panel must include the following: cholesterol, that is serum total, lipoprotein direct measurement, high density cholesterol, and triglycerides. So when you look at the description, consisting of HDL, serum cholesterol, and triglycerides. So all three are included here. So the first part, you can get the answer 80,061. So C and D may be suitable. So once you go to the next part, that is glucose. So for the glucose, you can go to the main search term, index term glucose, then go to the subterm blood test. Blood test, there are 3 codes available: 82,947, 48, and 50. Again, come back the tabular list and confirm the answer. Once you go to the tabular list, you can see 82,947 is glucose qualitative blood, except reagent stripped. 48 is blood reagent stripped, and 950 is post glucose dose. So in the case, you can see along with the quantitative glucose test, the physician uses the automated equipment. So there's no reagent strip involved here. So the correct code will be 82,947. That is glucose quantitative blood. So the correct answer will be answer C. Question number 2. A 28-year-old woman presented to the obstetrician stating that she tested positive on a home pregnancy test. The obstetrician decides to perform a urine pregnancy test in the office for confirmation. What is the OB code for the pregnancy test only? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight the woman already tested positive on a home pregnancy test. In the office urine pregnancy test for confirmation. So when you look at the answer, all answers are adjacent codes. So you can use the elimination method to find the answer. So once you go to the codes, 81,000 is urine analysis by dipstick or tablet reagent for bilirubin, glucose, hemoglobin. There are so many listed here. And 81,002 is non-automated without microscopy. 81,003 is automated without microscopy. 81,025 is urine pregnancy test by visual color comparison method. So that is the correct code. So the correct answer will be answer D. In the real working scenario, you had to use the CPT alphabetic index. In the CPT alphabetic index, first go to the main search term, index term urine, then go for the subterms pregnancy test. It will lead you to the code 81,025. Or else first go to the main index term urine analysis, then go for the subterm pregnancy test. It will lead to the same code. Come back to the tabular list and confirm the answer. Question number 3. A physician orders an ultra-sensitive fibrin degradation products, that is D-dimer test, for a patient with a suspected deep vein thrombosis. Which CPT code should be reported for this laboratory service? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is ultra-sensitive fibrin degradation products test. So once you look at the answer, all answers are adjacent code. So you can use the elimination method in the exam. So once you go to the code, 88,362 is fibrin degradation products agglutination slide semi-quantitative. So that is not possible. 378 is fibrin degradation products D-dimer qualitative semi-quantitative. But in our case, it is ultra-sensitive fibrin. But this is not mentioning that. 379 is quantitative. 380 is ultra-sensitive for evaluation for various thromboembolism, qualitative or semi-quantitative. So this code you have to read as the follow-up code of this one. You can see the semicolon here. So code number 85,380 is fibrin degradation products D-dimer, ultra-sensitive, qualitative or semi-quantitative. So that is the case here. So the correct answer will be answer D. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. In the CPT alphabetic index, you can go for the main search term, that is fibrin degradation products, and go for the subterm D-dimer, that is here. And again come back to the tabular list and confirm the answer. Once you confirm, the correct answer will be 85,380. Question number 4. A patient has a cholecystectomy and a soft tissue lipoma removed during the same operative session. Both specimens were sent to pathology in separate containers are examined by the pathologist. What CPT codes are reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is cholecystectomy and soft tissue lipoma removed, sent to pathology in separate containers, examined by the pathologist. When you look at the answer, all answers are adjacent codes, so you can use the elimination method to find the answer. When you go to the surgical pathology course, you can see 88,300 is level 1, that is surgical pathology, gross examination only. 302 for level 2, surgical pathology, gross and microscopic examination. But in our case, only 304 and 305 are used, so you can directly go to that course. So 88,304, you can see. Procedure done is cholecystectomy. So cholecystectomy means removal of gallbladder. So you have to search for the gallbladder. So this is the level 3. The codes are arranged in the alphabetic order, so you can easily search through. So go down, go to the word G. You can see the gallbladder is here. So in 304, the gallbladder is included. Similarly, you have to search for the lipoma. So again, go down. You can see soft tissue lipomas. Both the procedures are included in the level 3 code, that is 88,304. So for the removal of gallbladder, one time you had to use, and removal of lipoma you had to use another time. So the correct answer will be 88,304 into 2. So here you can see cholecystectomy is the removal of gallbladder and the lipoma removal. So both are included in the code 88,304. The correct answer will be answer B. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. In the alphabetic index, you have to go for the surgical pathology and gross and microscopic exam. So you have to check all the levels here. So once you check, the correct answer will be 88,304. So both procedures are included within this. So you can multiply by 2. Question number 5. A patient with family history of breast cancer has a BRCA1 gene analysis ordered. The physician wants the full sequence analysis. What is the correct CPT code for this test? So there are 4 answers available. Take your CPT code book and find the answer. Here you have to highlight this is BRCA1 gene analysis, full sequence analysis. Once you look at the answers, all answers are adjacent codes, so you can use the elimination method for the exam purpose. So once you go to the code directly, 81,162 is BRCA1 and BRCA2. Gene analysis, full sequence analysis, and full duplication and deletion analysis. But in our case, only BRCA1 gene is analyzed, not 2. So this answer is not possible. 81,163 is full sequence analysis for both these genes. 81,165 is BRCA1 gene analysis, full sequence analysis. So that is the correct code here. So the correct answer will be answer C. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. In the CPT alphabetic index, first you have to go for the main search term, that is breast, then go for the subterm cancer gene analysis, then go for the subterm BRCA, then go for the subterm full sequence. It will lead you to the 81,162 to 62 and 65. Again, come back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 6. This is the final question of this pathology and laboratory series. Sperm is being prepared through a washing method to get it ready for the insemination of 5 oocytes for fertilization by directly injecting the sperm into each oocyte. Choose the CPT codes to report this service. So there are 4 answers available. Take your CPT code book and find the answer. So here I have to highlight there are 2 procedures done. One is sperm being prepared using the washing method, and second one is insemination of 5 oocytes for fertilization done. So you have to code for the both procedures. Once you look at the answers, all answers are adjacent codes. You can see the first procedure, these adjacent codes. The second procedure, these are adjacent codes. So you can use the elimination method for the exam purpose. So once you go to the code 89,257, sperm identification from aspiration, that is not possible. 89,260 is sperm isolation, simple prep. Example, sperm wash and swim up for insemination or diagnosis with semen analysis. So that's the correct code for the first procedure, that you can see sperm being prepared by washing method. So for first procedure, 89,260. So B and D are possible. Once you look at other codes, 261 complex prep, so that is not here. 268 insemination of oocytes. So that is the procedure here, insemination of oocytes, but they are mentioning 5 oocytes for fertilization directly injecting to the sperm. Read the other code 89,280 assisted oocyte fertilization. Assisted means they are injecting. Micro technique less than or equal to 10 oocytes. So in our case 5 oocytes. So the correct code will be 89,280. So the correct answer will be answer B, both 89,260 and 280. If you encounter this case in real working scenario, you have to use the CPT alphabetic index. For the first procedure is sperm isolation. So the main search term is isolation. Again, go for the subterm sperm. It will lead to the following 2 codes. Again, come back the table list and confirm the answer. Similarly, for the second procedure is fertilization. So again, go for the fertilization. This one is assisted, oocyte, and micro technique. It will lead you to the following 2 codes, 89,280 and 281. Again, come back the table list and confirm the answer. Once you confirm, the correct answer will be answer B. Chapter 15, CPT Medicines 90,000 series question and answers. There are 6 questions. Question number 1. A 20-month-old patient with end-stage renal disease receives dialysis twice per week while awaiting a kidney transplant. The physician provides weekly face-to-face counseling sessions with the parents regarding the patient's care and status. Which CPT code correctly reports the monthly ESRD related services for this patient? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this 20-month-old, that is less than 2 years old patient, dialysis twice per week and awaiting kidney transplants, and weekly face-to-face counseling. When you look at the answers, all answers are adjacent codes, so you can use the elimination methods for the exam purpose. So once you go to the code 90,951, end-stage renal disease related services monthly for patients younger than 2 years of age. In our case, this is 20 months means less than 2 years. So younger than 2 years of age, to include monitoring for the adequacy of nutrition, assessment of growth and development, and counseling of parents with 4 or more face-to-face visits by the physician or other qualified healthcare professional per month. So once you look at the description here, it says weekly face-to-face counseling. Weekly face-to-face counseling means 4 per month. So that is exactly mentioning here. So the correct code will be 90,951. There's no need to multiply it by 4 because the counseling is weekly face-to-face. So for monthly, it's 4 times. So 4 times is included here. So this code is correct. That is B is the correct answer. Once you look at other answers, 90,952 for with 2 to 3 face-to-face visits. But in our case, it is 4. 954 is end-stage renal disease for patients 2 to 11 years. But in our case, less than 2 years. So the correct answer will be answer B. If you encounter this case in a real working world, you have to use the CPT alphabetic index. In the CPT alphabetic index, you have to search for the main search term, main index term, that is end-stage renal disease services, and monthly the code series are here. Again, come back the table list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 2. A 24-year-old female presents to the clinic with an acute asthma exacerbation. The provider performs a baseline spirometry. Following the initial test, the patient is administered 1 milligram of albuterol via nebulizer. After an appropriate waiting period, the spirometry is repeated to evaluate the patient's response to the bronchodilator. The results indicate an obstructive pattern with slight improvement in air movement. What is the correct CPT code for this encounter? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight patient admitted with the acute asthma exacerbation and baseline spirometry performed and nebulizer administered with the albuterol. Again, the spirometry is repeated to evaluate the patient response to bronchodilator. So, look at the answers. All answers are adjacent codes, so you can use the elimination method for the exam purpose. Once you go to the code, 94,010 says spirometry including graphic record, total and timed vital capacity, expiratory flow rate measurements with or without maximal voluntary ventilation. But that is not the case here. 94,012 is measurement of spirometric forced expiratory flow rates before and after bronchodilator in an infant child through 2 years of age. But in our case, this is 24-year-old adult. So this is not suitable. When you look at other answer, 94,060, bronchodilation responsiveness, spirometry as in 94,010, that is here. pre and post bronchodilator administration. So that is the correct description here. So pre bronchodilation, they are baseline spirometry. In after bronchodilator, another reading done. So the correct code will be answer C. So if you encounter this case in real working world, you have to use the alphabetic index. Once you go for the alphabetic index, you can directly go for the index term spirometry. It will lead you to the following code series. Again, come back the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 3. A patient arrives at her oncologist's office for a scheduled chemotherapy infusion. Upon evaluation, she is found to be severely dehydrated. The physician postpones the chemotherapy treatment and instead orders intravenous hydration therapy for that visit. The hydration infusion is administered for a total time of 1 hour and 10 minutes. What is the appropriate CPT codes to report for this encounter? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight patient came for the scheduled chemotherapy infusion, but the chemotherapy is postponed and the hydration infusion administered for total time of 1 hour and 10 minutes. So once you look at the answers, all answers are adjacent codes. So you can use the elimination method for the exam purpose. So once you look at the codes, 96,413 is chemotherapy administration, intravenous infusion technique up to 1 hour. But in this case, the chemotherapy is postponed. So no need to code for the chemotherapy. Let's go for the other code, 360, intravenous infusion, hydration, initial 31 minutes to 1 hour. So in our case, 1 hour and 10 minutes. So this is the first code. Let's see the suitability of the add-on codes. Once you look at the add-on code, 361 says each additional hour lists separately in addition to code for primary procedure. And also within bracket it says report 96,361 for hydration infusion intervals greater than 30 minutes beyond 1 hour increment. This is very important point here. So beyond 1 hour, it should be greater than 30 minutes. But in our case, it's 10 minutes. You can't count this for the suitability for add-on code because if you want to add the add-on code, it should be more than 30 minutes. So if it is 31 minutes only, you can add the add-on code. Otherwise, you have to use only the primary code, that is 96,360. This is very careful. You have to read the within bracket notes. So the correct answer will be answer B. So if you encounter this case in real working world, you have to use the alphabetic index. So in the alphabetic index, here there's no chemotherapy, only the hydration given. So the main index term is hydration. Then go for the subterms intravenous. It will lead to the following 2 codes. Again, come by the tabular list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 4. A patient has been having difficulties swallowing. He is set up for a flexible fibro-optic endoscopy evaluation of swallowing by video recording. What is the correct CPT code for this procedure? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight the procedure is flexible fibro-optic endoscopy evaluation of swallowing by video recording. So once you look at the answer, all answers are adjacent codes. So you can use the elimination method in the exam to save the time. So once you go to the codes, 610 says evaluation of oral and pharyngeal swallowing function. That is not the case here. 611 motion fluoroscopic evaluation. This is not the motion flow. This is flexible fiber optic. That is not the case here. So 92,612 for flexible endoscopic evaluation of swallowing by cine or video recording. So that is the exact case here. So evaluation of swallowing by video recording. So the correct answer will be answer C. If you encounter this case in real working world, you have to use the CPT alphabetic index. In the CPT alphabetic index, the main term is endoscopy and the subterm is swallowing. Once you go to the subterm, it will lead to the following 4 codes. Again, come back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 5. A 58-year-old male patient underwent right and left heart catheterization with left ventriculography. During the procedure, the patient also completed a physiologic exercise study using bicycle ergometry. Which CPT codes correctly describe this service? So there are 4 answers available. Take your CPT code and find the answer. So here you have to highlight the procedure is right and left heart catheterization with left ventriculography. Also another procedure, that is physiologic exercise study using bicycle ergometry. So once you look at the answers, there are adjacent codes used. So you can use the elimination method for the exam. So let's go to the codes directly. 93,451 says right heart catheterization, but in our case it is right and left, so that is not suitable here. 452 means left heart catheterization. That is not the case. 453 is combined right and left heart catheterization, including intra-procedural injections for left ventriculography. That also included here, left ventriculography, imaging supervision and interpretation when performed. So this is the code for the first procedure. So you can select the answer C and D. For the next procedure, let's read the other code. Add-on code 93,464. Physiologic exercise study. Example, bicycle or arm ergometry, including assessing hemodynamic measurements before and after, in addition to code for primary procedure. So that also suitable for the second procedure. So the correct answer will be answer C. So if you encounter this case in real working world, you can use the CPT alphabetic index. So in the CPT alphabetic index, first procedure is cardiac catheterization. So the main index term is cardiac catheterization, and the subterm is combined left and right heart. It will lead to the following two codes, but with the left ventriculography also done. So the subterm is with left ventriculography. There are three codes available. Again, come back the tabular list and confirm the answer. Similarly, for other tests, that is exercise stress test, you can see physiologic exercise study. That means exercise stress test, and cardiovascular. There are codes here. Again, come back the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 6. This is the final question of the medical series. A 55-year-old female presents with a focal weakness and twitching in the right lower extremity. She undergoes 3 nerve conduction studies and needle electromyography of 3 muscles. How should these services be correctly reported? So there are 4 answers available. Take the CPT codebook and find the answer. So here you have to highlight there are 2 procedures. One is 3 nerve conduction studies and needle electromyography of 3 muscles. When you look at the answers, all answers are adjacent codes, so you can use the elimination method. Once you go to the code, 95,860 says needle electromyography, one extremity with or without related paraspinal areas. But in here, in this case, 3 nerve conduction studies, so that is not suitable. 95,863 is 3 extremities with or without related paranasal areas. Code, once you go to the code 95,907, nerve conduction studies, 1 to 2 studies. 908 says 3 to 4 studies. So here 3 nerve conduction studies, so 3 to 4 studies. So this code is the primary code, so C and D may be possible. Once you look at the other code, that is 95,885 is needle electromyography, each extremity with related paraspinal areas when performed done with nerve conduction. But when you look at these 2 codes, these are standalone codes, only electromyography standalone, but these codes are add-on codes with the nerve conduction study. So you have to use these codes, not these 2. So this says needle electromyography, each extremity with related paraspinal areas when performed done with nerve conduction, amplitude and latency or velocity study, in addition to code for primary procedure. So you have to use primary procedure as 95,908 and the add-on code as 95,885. So if you encounter this case in a real working world, you have to use the CPT alphabetic index. In the CPT alphabetic index, the first main index term is nerve conduction. Then go for the subterm is motor or sensory nerve. It will lead to the following code series. Again, come back the tabular list and confirm the answer. Similarly, for the second procedure, that is electromyography, needle and the extremity. Again, it will lead to the following 3 codes. Again, come back the tabular list and confirm. Once you confirm, the correct answer will be answer C. Chapter 16, Evaluation and Management Series, Question and Answers. Question number 1. A physician conducts a synchronous audio-video consultation for a new patient with straightforward MDM lasting 80 minutes. Which code is reported? So there are 4 answers available. Take your CPT codebook and find the answer. So here you have to highlight this is a synchronous audio-video consultation, that is a telemedicine service. New patient, straightforward MDM lasting 18 minutes. So when you look at the answers, all answers are adjacent codes, so you can use the elimination method for the exam purpose. So once you go to the answers, 99,202 is office or other outpatient, so that is not possible. When you look at other answer 98,000, it says synchronous audio video visit for the evaluation and management of a new patient which requires a medically appropriate history and examination and straightforward medical decision making. When using total time on the date of the encounter for code selection, 15 minutes must be met or exceeded. So in our case, it's 80 minutes. So the correct answer will be Answer B, that is 98,000. If you encounter this case in real working scenario, you had to use the table of contents or the table or the alphabetic index method. So for the evaluation and management services, you can directly go to the table of contents of that chapter. This is the telecommunication service. You can see synchronous audio video evaluation and management services for new patient. It will lead you to the 98,000 to 98,003. Again, go back the table list and confirm the answer. Or else you can use the table, that is telemedicine synchronous audio video EM service. This is straightforward. So you can go to the straightforward and it will lead you to the code 98,000. If you want to use the alphabetic index, go directly to the main index term, that is telemedicine, and again go to the synchronous care audio video visit. It will lead you to the following code series. Again come back to the table list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 2. Clinical staff spent 45 minutes on a calendar month managing a patient with 2 chronic conditions. Which codes are reported? So there are 4 answers available. Take your CPT codebook and find the answer. So here you have to highlight this is clinical staff spent 45 minutes, patient with 2 chronic conditions. So when you look at the answer, all answers are adjacent codes, so you can use the elimination method. So once you go to the code directly, 99,490 is chronic care management services with the following required elements. Multiple 2 or more chronic conditions. In our case, 2 chronic conditions. Expected to last at least 12 months or until the death of the patient. First 20 minutes of clinical staff time directed by the physician or other qualified healthcare professional per calendar month. So first 20 minutes you had to use this code, but in our case it is 45 minutes. So each additional 20 minutes, the clinical staff time directed by the physician. So you can use the add-on code. So the correct answer will be answer B. So if you encounter this case in a real working world, you can use the alphabetic index. In the alphabetic index, you can go to the by 2 methods. One is you can go to the care management services. Then you have to select the chronic care management. Or else the best method that is you can get used is go to the evaluation and management services. This is the index term, evaluation and management services. Then go to the subterm chronic care. It will lead you to the following code series. Again, come back the table list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 3. A physician makes a home care visit on a 63-year-old patient that is a hemiplegic having insomnia for the last 2 weeks. The patient has been homebound for the last year. The last visit from this physician was 4 months ago to control his diabetes mellitus. The physician performs medically appropriate history and examination. The provider notes the DM is controlled and discuss some ways to assist with the insomnia. The physician then speaks with the spouse about the possibility of placing the patient in the nursing facility. What CPT code is reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is a home care visit and last visit from the physician was 4 months ago. So this is a established patient. The physician performs medically appropriate history and examination. Provider notes diabetes is controlled and discuss some ways to assist with the insomnia. It's like a low level of medical decision making. So once you look at the answers, all answers are relatively adjacent codes. So you can use the elimination method for the exam purpose. Once you go to the code, 99,213 is office or other outpatient visit. So that is not possible here. It's a home care visit. 99,342 is home or resident visit for evaluation of management of a new patient. But here is an established patient. So that is not suitable. 344 for home or resident visit for the evaluation management of a new patient. But here established patient. So 99,348 is home or resident visit for the evaluation and management of an established patient which requires medically appropriate history or an examination and low level of medical decision making. So the correct answer will be answer D. So if you encounter this case in a real working world, you had to use the alphabetic index. For that, go to the index term evaluation and management services, then go to the subterm home or resident visit, and here it is the established patient. So go to the subcategory of established patient. It will give you the following code series. Again, come back the tabular list and confirm the answer. Once you confirm, the correct code will be 99,348. Question number 4. A critical care patient is attended to by a physician for a total duration of 80 minutes on a single calendar date. Which code should be reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is a critical care patient and duration of care is 80 minutes. Once you look at the answers, all answers are adjacent codes, so you can use the elimination method. So once you go to the code, 99,291 is critical care evaluation and management of a critically ill or critically injured patient, first 30 to 74 minutes. In our case, it's 80 minutes, so this is 74. So add-on code is 99,292 is each additional 30 minutes. Some add-on codes may need half the time, that is 15 minutes to be eligible for this add-on code. But in this scenario, you can see the table, example table, it says clearly 30 to 74 minutes, you can use the 99,291. Additional, that is 1 hour and 15 minutes, you can use this add-on code, that is 99,292. So if the additional minute is even the 1 minute, you can use the add-on code. So the correct answer will be answer B. So if you encounter this case in real working world, you can use the alphabetic index. Again, go to the main index term, evaluation and management services, then go for the subterm, that is critical care. It will lead you to the following two code. Again, come back to the table list and confirm the answer. Once you confirm, the correct answer will be answer B. Question number 5. A physician spends 43 minutes performing final examination and discharge paperwork for a patient being sent home from the hospital. Which code is reported? So there are 4 answers available. Take your CPT codebook and find the answer. So here you have to highlight this is 45 minutes performing final examination and discharge paperwork. So it's the discharge code. So once you look at the answers, all answers are adjacent codes. So you can use the elimination method for the exam purpose. Once you go to the code, 99,238 is hospital inpatient or observation discharge day management, 30 minutes or less on the date of encounter. So in our case, 45 minutes. So the next code is 239, that is more than 30 minutes on the date of the encounter. So the correct answer will be answer B. So if you encounter this case in real working world, you can use the alphabetic index. So in the alphabetic index, go to the main index term, evaluation and management services, then go for the subterm hospital services. There you can use the discharge day management code. So there are 2 codes available. Again, come back to the table list and confirm. Once you confirm, the correct answer will be answer B. Question number 6. The physician performed an annual examination on a 47-year-old male new patient with a history of congenital heart disease. What is the correct EM code? So there are 4 answers available. Take your CPT codebook and find the answer. So here you have to highlight this is annual examination. So this annual examination are included in the preventive care medicine, and patient is new and history of congenital heart disease. Once you look at the codes, also adjacent codes, so you can use the elimination method. So once you go to the code, 99,381 for a new patient code, initial comprehensive preventive medicine, evaluation and management of an individual, including an age and gender appropriate history, examination, counseling, anticipatory guidance or risk factor reduction interventions, and the ordering of laboratory or diagnostic procedures, new patient and infant age under than 1. So for this new patient, less than 1 year, 386 for 40 to 64 years, 387 for 65 years and older. So in our case, it's 47. So 47 included in this code. So the correct answer will be answer A, that is 99,386. So if you encounter this case in real working world, you can use the alphabetic index. So in the alphabetic index, the main search term is the evaluation and management services. Then this is the preventive service. Go for the subterm of preventive service. Again, it's a new patient. So new patient, these series of codes are recommended. Again, come back to the table list and confirm the answer. Once you confirm, the correct answer will be answer A.
Chapter 17, Anesthesia. There are 4 MCQs. Question number 1. A 54-year-old man is having a coronary artery bypass grafting with pump oxygenator, where the anesthesiologist is also using total body hypothermia. What is the correct code for this procedure? There are 4 answers available. Take your CPT codebook and find the answer. Here you have to highlight this is coronary artery bypass grafting with pump oxygenator. Also, total body hypothermia is used. So you can use 2 methods. One for the CPT alphabetic methods in the real working scenario, but for the exam you can use the elimination method. Once you look at the answers, all answers are adjacent code. There are 2 sets of adjacent codes, so you can use the elimination method to find the answer. So code 00566 is anesthesia for direct coronary artery bypass grafting without pump oxygenator. In our case, with pump oxygenator. So the next code 00567 is with pump oxygenator. So answer
C and D are possible. So regarding total body hypothermia, you can see 9916 anesthesia complicated by utilization of body hypothermia. List separately in addition to code for primary anesthesia procedure. So this will be the correct add-on code. So the correct answer will be answer C. So if you encounter this case in real working world, you had used the CPT alphabetic index. In the CPT alphabetic index, first go for the main index term anesthesia, then go for the subterm heart, again go for the subterm coronary artery bypass grafting. It will lead you to the following two code. Again come back and confirm the answer. Also the special circumstance for the anesthesia, that is total body hypothermia. So here again you have to go to the main index term anesthesia, then go for the subterm special circumstances. Here there are four circumstances available: emergency, extreme age, hypotension and hypothermia. In our case hypothermia, it leads you to the following code. Again come back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C. Question number 2. A healthy 79-year-old male patient with communicating hydrocephalus undergoes creation of a ventriculoperitoneal shunt. What is the correct anesthesia code selection for this procedure? So there are four answers available. Take your CPT code book and find the answer. So here you have to highlight this is healthy 79-year-old, so that more than 70, so it's an extreme age group, but patient is healthy with communicating hydrocephalus undergoes creation of a ventriculoperitoneal shunt. Again, you can use the CPT alphabetic index, but for the exam purpose, to save time, you can use the elimination method to find the answer, so you can directly go to the codes. So once you go to the code 00210, that is anesthesia for intracranial procedures not otherwise specified, but 00220 is cerebrospinal fluid shunting procedure. So that is the procedure here, cerebrospinal fluid shunting. So correct primary code will be 00220, and here the modifier P1 for the normal healthy patient. Even the age is extreme but patient is healthy, so you can use the modifier P1. And for the extreme age, you can see 99,100, that is anesthesia for patient of extreme age, younger than 1 year and older than 70. So list separately in addition to code for primary anesthesia procedure. So the correct answer will be answer A. So if you encounter this case in real working world, you had used the CPT alphabetic index. In the CPT alphabetic index, first go for the main term anesthesia, then go for the subterm shunt, then go for the subterm spinal fluid. It will lead to the following code. Again come to the tabular list and confirm the answer. And for the extreme age, you can go to the anesthesia, then go to the special circumstance. Here extreme age, so that is 99,100. Always confirm with the tabular list. Once you confirm, the correct answer will be answer A. Question number 3. A 75-year-old patient presents for surgical debridement of third-degree burns sustained while cleaning brush. The burns cover 13% of his body. Which code set is correctly identifies the anesthesia services provided? So there are four answers available. Take your CPT code book and find the answer. So here you have to highlight this is a 75-year-old patient, again in extreme age, and surgical debridement of third degree burns 13% of his body. So once you look at the answers, all answers are addition code, so you can use the elimination method for the exam. I'll do the CPT alphabetic index method as well. So when you go to the course, 1951 is anesthesia for second and third degree burn excision, less than 4% of total body surface area. 1952 is between 4 and 9% of total body area, but in our case it is 13%. So the add-on code is each additional 9% of total body surface area or part thereof, list separately in addition to the code for primary procedure. So here you have to be careful. The add-on code should be used with 952, not with 951. Here within bracket it says used 01953 in conjunction with 1952, not with 1951. So 1952 is for up to 9%. So another 4% is rest there. So for that you have to use the add-on code. So first code will be 19,052 and add-on code will be 19,053. And for the extreme age, you can use the add-on code 19,100. So that is for anesthesia for patient of extreme age, younger than 1 year and older than 70. So the correct code will be answer C. So if you encounter this case in real working world, you can use the CPT alphabetic index. In the CPT alphabetic index, the main search term is anesthesia, then go for the subterm is burns. Here the subterm is debridement or excision. It will lead you to the following code series 1951 to 53. Again come back the table list and confirm the answer. And for the extreme age, again go for the anesthesia subterm special circumstances. Here you have to go for the extreme age, that is 19,100. So the correct answer will be answer C. Question number 4. A 38-year-old female undergoes an extended ophthalmoscopy with retinal drawing. The performing physician also provides the anesthesia services because an anesthesiologist is unavailable. The physician documents a formal interpretation and report. How should this encounter be coded? So there are 4 answers available. Take your CPT codebook and find the answer. So here you have to highlight patient's age is 38. Procedure is extended ophthalmoscopy with retinal dwelling, and here very importantly the surgeon, that the physician also provides the anesthesia. So once you look at the answer, there are mainly 2 codes used with the modifier. So again you can use the elimination method for the exam purpose. So once you go to the code 148, that is ophthalmoscopy, but in our case it is extended ophthalmoscopy with retinal drawing. When you go to the next code 92,201, that is ophthalmoscopy extended with retinal drawing. So the correct code will be this 92,201, and the surgeon giving the anesthesia, so you have to give add the modifier, that is modifier 47 is anesthesia by surgeon. So the correct answer will be answer B. So if you encounter this case in real working world, you can use the CPT alphabetic index. So in the CPT alphabetic index, the index term is ophthalmoscopy and the subterm is retinal drawing. It will lead you to the code 92,201. Again modifier 47. So the correct answer will be answer B. Mock exam 2, chapter 18, final chapter, 10 cases. In the AAPC CPC exam, the last section is all about case-based scenarios, and this is where many students struggle the most. You will get 10 cases, and each one is designed to test your ability to accurately assign CPT codes, ICD-10-CM codes, and HCPCS Level II codes. Make sure to check the description below. You can download all 10 case scenarios in the PDF format and practice along. Now here's the real challenge. If you have ever taken a real AAPC CPC exam or even a timed practice test, you will already know you don't have enough time to read every case word by word. So trying to do that will slow you down and cost you valuable points. So instead, use this smart strategy to find answers quickly. Step 1. Read the question first. Don't start with the case, go straight to what is being asked. Step 2. Check the post-operative diagnosis. This helps you quickly identify the correct ICD-10-CM code. Step 3. Look at the procedures performed. Focus only on the procedure names to identify the correct CPT code. Step 4. Review the answer choices. They give you clues about what to look for. And step 5. Use the elimination method and remove incorrect options and narrow down to the best answer. So you will understand this when you do the questions in real time. So let's go to the questions. Case number 1. As I explained earlier, first go to the last question. So it's asking about CPT codes. So there are 4 codes available, all are adjacent codes. If it is asking for CPT code, you just read the procedure. No need to read all the description, just read the procedure. Also, if need, read the post-operative diagnosis. So here the post-operative diagnosis is unstable left distal radius fracture. Procedure done is closed reduction and percutaneous pinning with manipulation of left distal radial fracture. Anesthesia is general, so only those things you have to read. So no need to read for the detailed description. In case you cannot find the answer using this elimination method, then only you have to read the description to save the time. But for the real working scenario, you have to read all the document for the coding and billing. But this is for the exam purpose. Okay, so let's use the elimination method. Yes, the codes are adjacent codes. So first 25,600 is closed treatment of distal radius fracture or epiphyseal separation, includes close treatment of fracture of ulnar stolite when performed without manipulation. But in this case, close reduction but with manipulation, also with pinning. 25,654 with manipulation, but this is not telling about the pinning. 25,606. So it says percutaneous skeletal fixation of distal radius fracture or epiphyseal separation. So that also included here. You can see the percutaneous spinning. But you may ask, this code doesn't have the close reduction and the manipulation, but the manipulation and the reduction is included in this code and not reported separately. I created this question based on the CPC study guide question. So the correct answer will be 28,606 only. So the correct answer will be answer C. Case number 3. First look at the final question. It asking about CPT and ICD-10-CM codes. Both it asking. You have to read the post-operative diagnosis and the procedure. So once you look at the codes, all codes are adjacent codes. So you can use the elimination method. So if you cannot find the answer with this post-operative diagnosis and the procedure, then only read the full description for the exam purpose. So here you have to highlight the post-procedure diagnosis. That's the main important one. So post-procedure diagnosis, asthma, post-procedural diagnosis used for coding. And the procedure is psychophysiological therapy, biofeedback. And when you go for the answer, you may understand that for the biophysiological therapy, you need the procedure duration. So that's why I have highlighted this one. That is biofeedback procedure lasted approximately 35 minutes. That is biofeedback time. So let's go to the elimination method. So once you go to the answers, 90,875, that is individual psychophysiological therapy incorporating biofeedback training by any modality, that is face to face with the patient with psychotherapy 30 minutes. 876 for 45 minutes. So in our case it's 35 minutes, so less than 45. So the first code will be this one, 90,875. So that is the CPT code. Then let's go to the ICD-10-CM codes. So all are adjacent codes, so you can use the elimination method. Here J45.902 is unspecified asthma with status asthmaticus. In the diagnosis, it is not said about the status asthmaticus, so it's a uncomplicated one. So J45.909, that is unspecified asthma, uncomplicated. So the correct answer will be answer C, 90,875 and J45.909. Case number 3, again go for the final question. Here it is asking for the ICD-10-CM code only. So you have to be careful with the diagnosis. So once you go to the case scenario, here it says progress note. And finally the assessment, it says 50-year-old female with rectal bleeding. Report the code document in the assessment. Plan, we will schedule the patient for an outpatient colonoscopy. The patient was made aware of all risks involved with the procedure and was willing to proceed. So here you can see that the assessment says only the rectal bleeding. It not says any definite diagnosis. So you have to code with this rectal bleeding, this symptom as the ICD-10-CM code. So here you have to highlight the bleeding, bright red blood per rectum, that is patient presenting complaint. And she is here for today for evaluation of colonoscopy, but colonoscopy is not done. It is planned for another day. So once you go for the answers, case 62.5 is hemorrhage of anus and rectum. So that can be the case here. And case 64 is hemorrhoids and perianus venous thrombus. Case 62.4 is stenosis of anus rectum. So those are not possible. So the correct answer will be answer D, that is case 62.5, that is hemorrhage of anus and rectum. Case number 4, again go down the question. What are the CPT and ICD-10-CM codes reported? So once you look at the answers, all answers are adjacent codes. You can use the alphabetic index. So for the ICD-10-CM, you have to use the post-operative diagnosis, and the CPT code, you can use the procedure name. In case if you cannot find the answer with the procedure, then you can go for the detailed description for the exam purpose. I am telling this to minimize the time spent, because when you come to these case scenarios, it's the last 10 questions, it is very difficult to find the time. So go quickly with this shortcut method. So here you have to highlight the post-operative diagnosis, that is comminuted intra-articular distal radius colles fracture, left wrist. Procedure is application of uniplane fixation and closed reduction of left distal radius fracture under fluoroscopy. Anesthesia general endothecal. As the answers are adjacent codes, we can use the elimination method for the exam to save the time. So here you can see the procedure, application of a uniplane fixation, that is one procedure, and close reduction of the left distal radius fracture at the fluoroscopy, that is another procedure. You can compare the first codes, that is 20,690 and 92. So once you read the code description, 20,690 is application of a unique plan unilateral external fixation system. 20,692 is application of a multi-plan unilateral external fixation system. So in the procedure, it clearly says application of uniplan fixation. So the correct first code will be 20,690. So the side is left side. So modifier will be left LT. Then let's go for the second code, that is 25,605. So only one code. So 605 is with manipulation. That is close treatment of distal radius fracture or epiphyseal separation includes close treatment of fracture of ulnar styloid when performed with manipulation. So the code will be 25,605, but there's two modifiers, 51 and 59. 51 for multiple procedures, 59 for distinct procedural service. But here this is a multiple procedure, so correct modifier will be 51. When you go to the ICD 10 cm code, that also adjacent code, so you can read the codes directly. S52.531 is collapse fracture of right radius, but in our case it is left wrist. So in the next code is S52.532, that is collapse fracture of left radius. So that is the correct code. So the correct answer will be 20,690 and 25,605 S52.532A. So the correct answer will be answer A. Case number 5. The questions are, what are the CPT and ICD 10 cm codes? You can see those are adjacent codes available. So let's see the post-procedure diagnosis, that is varicose vein disease with inflammation, venous insufficiency, leg pains due to varicose veins. And the procedure done is peripheral vascular duplex ultrasound evaluation of the venous anatomy of the lower extremities. And don't forget, if it is given any finding, you had to definitely read the finding. So finding says varicose vein disease with inflammation, varicose insufficiency, leg pains due to varicose veins. So let's use the elimination method to find the answer. So here you can see the CPT codes 93,970, 71 and 30. Those three codes are available. When you go to the 93,970, that is duplex scan of extremity veins including responses to compression and other maneuvers. Complete bilateral study. So here procedure you can see peripheral vascular duplex scan, evaluation of venous anatomy of the lower extremities. So extremities plural, so bilateral is correct. 930 is duplex scan of upper extremity, arteries or artery bypass. This is the lower extremity. Also it is artery, but in our case it's venous, so that is not correct. 93,971, that is unilateral or limited study, but here it's bilateral. So when you go to the ICD 10 cm codes, there are codes you can see I83.11, 12 and 1. So 3 codes. So I83.1, that is varicose veins of lower extremities with inflammation. I83.11 says varicose veins of right lower extremity with inflammation, and I83.12 says varicose vein of left lower extremity with inflammation. So the correct answer will be answer A, that is 93,970, and I83.11 for right side and I83.12 for left side. Case number 6 is asking for CPT and ICD 10 cm codes. You can see all adjacent codes, so you can use the elimination method. So here you have to highlight the post-operative diagnosis, that is rectal prolapse, and the procedure, that is operation done is laparoscopic proctopexy. So that is one procedure, and cystourethropy with placement of unilateral urethral stent. So there's two procedures done. So anesthesia is general. So let's go for the elimination method. So once you look at the first code, that is 45,400, 540. So two codes are available. When you look at the code 45,400, that is says laparoscopy surgical proctopexy for prolapse. So that is the case here, laparoscopic proctopexy. But next code is 45,504, that is proctopexy. You can see this says laparoscopic, not the abdominal. So the correct first code will be 45,400. Then for the second procedure, you can see there are codes 52,332 and 41. So you can compare those two. 52,332 for cystourethropy with insertion of indwelling catheter stent. So in this case, you can see cystourethropy with placement of unilateral urethral stent. So that is the correct code. If you read the other code 52,342, that is cystourethropy with the treatment of urethral stricture. But here it's not telling about the stent. So the correct code here will be this one. So when you go to the ICD 10 cm codes, there are two codes available, K62.3 and K62.2. So once you read the code descriptions, K62.2 is anal prolapse of the anal canal. 62.3 is rectal prolapse. So in our case, it's a rectal prolapse. So the correct code will be K62.3. So the correct answer will be answer A, 45,400 and 52,332 and K62.3. Case number 7, again it asking for the CPT and ICD 10 cm code. So it's a radiology report. So here you have to highlight the examination, that is X-ray lumbar spine. And the technique is 6 views of lumbosacral spine and bending. And impression, that is the diagnosis, is lumbar spondylosis at L2 to L3 and L3 to L4. So to save this time in the exam, you can use the elimination method to find the answers quickly. So once you go to the codes, let's look at the CPT code. You can see 72,084, 72,114. Two codes are available. So once you look at the code 72,084, that is the continuation of previous code. That is radiologic examination, spine, entire thoracic and lumbar, including skull, cervical and sacral spine, minimum of 6 views. But in our case, 6 views of lumbosacral spine, but this says thoracic lumbar. So in our case, lumbosacral. So that is not possible. When you look at the other code, 72,114, that also continuation of previous code. Radiologic examination, spine, lumbosacral, complete, including bending views, minimum of 6 views. So that is the correct code. You can see 6 views of lumbosacral spine and bending. Here modified 26, that is professional component is added for all codes, because you can see this report says not only the X-ray but also the finding, that is the professional components involved here. So the modified 26 should be added. Once you go to the ICD-10 codes, there are 3 codes available: M47.817, M54.50 and M47.816. So once you go to the codes directly, M47.816 says spondylosis without myelopathy or radiculopathy, lumbar region. 817 says same at lumbosacral region, but in our case it says lumbar spondylosis. So the correct ICD-10 code will be M47.816. So the correct answer will be answer D. That is case number 8. Read the question. So it's asking for only the CPT code. So here you have to highlight. So it is not asking the ICD-10 code, but better to highlight the diagnosis that says full thickness burn wound to anterior left lower leg, and the operation says split thickness graft approximately 35 centimeters and preparation of the wound. So preparation, you can see split thickness skin graft was harvested from the left lateral buttock area approximately at the depth of an inch. So this is the skin graft. So the preparation of PN side also important. So when you look at the answers, all answers are adjustment code. So you can use the elimination method. So once you go to the code 15,100, that is split thickness autograft, trunk, arms, legs, first 100 square centimeter or less. So in our case it is 35, so less than 100 centimeter. So that will be the first code. Then let's check the code for the donor side preparation, that is 15,002, surgical preparation or creation of recipient side by excision of open wounds, burn a scar or incisional release of a scar construction, trans arm legs, first 100 centimeter or less. So this is less than 35. So the second code will be 15,002. So the correct answer will be answer D. Here you have that the modifier 51, that is for the multiple procedures. So the side is left side, that's what the left modifier also added here. Case number 9, it also asking only the CPT codes. So you can see the adjustment code, so you can use the elimination method. So as it is asking the CPT code, so you have to highlight the postoperative diagnosis and the procedure name. The postoperative diagnosis says recurrent right sided epistaxis. The procedure name is right maxillary antrostomy with biopsy and right internal maxillary artery ligation. So there are 2 procedures. So no need to read the description. You can, as you use the elimination method for the exam purpose. So once you go to the codes, the first CPT code is 31,267 and 37 and 56. Once you go to the 31,256 is nasal or sinus endoscopy, surgical with maxillary antrostomy. Here you can see right maxillary antrostomy with biopsy. But this is not telling you anything about the biopsy. When you go to the other codes, 31,267 is with removal of tissue from maxillary sinus, that is the biopsy. So the correct first code will be this one, 31,267. Once you read other code, 31,237 is nasal or sinus endoscopy, surgical with biopsy, polypectomy or debridement. Here it is not mentioning anything about the antrostomy, so that is not possible. So the second part is right internal maxillary artery ligation. So once you go to the other code, 30,915, that is ligation arteries ethmoidal, but 30,920 is internal maxillary artery transantral. So here you can see right internal maxillary artery. So the correct second code will be this one. So the correct answer will be answer A, that is 31,265 right side and 30,920 right side for this internal maxillary artery ligation. Case number 10 and the final case. Here it's asking what are the CPT and ICD-10 CM codes. So it's asking both CPT and ICD-10 CM codes. Once you look at the codes, all suggestion codes, so you can use the elimination method. So here you have to highlight this is the upper endoscopy procedure. So the extent of the examination is upper endoscopy, and the reason for the examination is GERD, that is gastroesophageal reflux disease. And also you have to highlight the findings. Here the esophagus was examined and no abnormalities were seen. The stomach was examined and no abnormalities were seen. And the small bowel was examined and no abnormalities were seen. So there are no abnormalities, only the gastrointestinal reflux disease, that is the diagnosis, and the procedure done is upper GI endoscopy. So let's use the elimination method here. The CPT code is 43,239, 35, 49 and 360. So let's compare the codes. So once you root the first code, 43,235 is esophagogastroduodenoscopy, that is the upper GI endoscopy, flexible transoral diagnostic including collection of specimens by brushing or washing when performed separate procedure. So that is correct. When you read the other codes, 238 is with transendoscopic ultrasound guided. Here nothing ultrasound guided. And 43,239 is with biopsy. Here there's no abnormalities seen, so there's no chance for biopsy. So that is wrong. So the correct CPT code will be 43,235. Once you look at the ICD-10 CM codes, there are only two codes, K21.9 and K21.00. So once you go to the code K21.9, that is gastroesophageal reflux disease without esophagitis, because here nothing said about esophagitis. And K21.0 is gastroesophageal reflux disease with esophagitis. So the correct ICD-10 CM code will be K21.9. So the correct answer will be answer B, that is 43,235 and K21.9. So this is the end of the chapter 18. So this completes the AAPC CPC mock or practice exam 2.
So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel, and if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.